Okay. So good morning, everyone. I'm happy to provide some welcoming remarks for this first Canada-Africa Academic Collaborations Conference organized by the African Institute at Western University in London, Ontario. My name is Saverio Stranges. I am a professor and chair of the Department of Epidemiology and Biostatistics at Western, as well as director of the African Institute. My background, I'm a public health physician and epidemiologist. I've been working in the area of global health for the last 20 years or so of my academic career. I'm very pleased to see a large number participants attending online this conference. We wish this could have happened in person, but the online format allows also participation from other geographic locations, so it does have that advantage. I'm very pleased to see also our keynote speakers already connected with us. I'll say just a few words about the African Institute that I have the privilege to lead alongside my colleague and friend, Dr. Melanie Katsivo, for the last nearly 5 years now. The African Institute, I'm proud to say, is one of the few entities across Western which truly connects scholars from virtually all faculty, is truly a transdisciplinary research entity, connecting. I was just refreshing my knowledge about the growing numbers of members we have, 136 scholars from all the faculties of Western University, as well as 140 students and junior colleagues. So we have a large community of scholars and students with interest in scholarly activity focusing on Africa. And so I'm very pleased to represent the African Institute. We just came back from a trip in Casablanca, Morocco, on Africa development, where we were invited as African Institute by colleagues at Victoria University to discuss with political policymakers and leaders from across the continent, particularly, of course, around public health issues in the continent. Just to give you an example of the reach of the African Institute, I will say, outside Western University as well. So, Melanie, I will pass the, you are the next speaker. If you please can provide your welcoming remarks.
Thank you very much, Saverio. My name is Melanie Katsivo, and I am Associate Director of the Africa Institute, and I look after programs and partnerships. And I also look after international partnerships for the Western's Frugal Biomedical Innovations Program, which is a partner of the Africa Institute. I think that, and my scholarly interests are in social determinants of life events and health equity. And at this point, I think I'd like to call upon the co-chairs, Pauline Omolo from the University of Nairobi and Seyram Afalet from Western University, to introduce themselves. Pauline, please.
Greetings and thank you very much. My name is Pauline Akoth from the University of Nairobi. I'm a PhD candidate. At the same time, I also lecture at the University of Nairobi. Apart from that, I'm a programs management expert also in monitoring and evaluation. And I'm glad to co-chair this conference this evening, morning. Over to you.
Seyram.
Hi, can you hear me okay?
Yeah.
Oh, great, thanks. Hi, my name is Seyram Yawo Apalite. I'm a third-year PhD student at the Western University, and my interest is in music education, and I'm also an instructor at the Faculty of Education, teaching the Teachers Education Department. Thank you.
Thank you, Seyram. Shazeb,
Hello.
a
So
member
I'm-
of the organizing committee.
So my name is Jose Lashik. I am a fourth-year software engineering student. Yeah, I'm doing my work study here at the Africa Institute, just helping out with everything tech related and graphics related. Doing some website updates as well, and hoping everything runs smooth here in the conference today. Thank you.
Thank you, Shazeb. Masa.
Hello, everyone. My name is Masa Tarawali. I'm a second-year PhD student at the University of Windsor, and I'm one of the organizing committee members here today. Thank you.
Thank you. Now, Seyram will read the land acknowledgement for us.
Hi. We acknowledge that Western University is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape, and Shononton nations on lands connected with the London Township. And with this, we respect the longstanding relationships that Indigenous nations have to this land, as they are the original takers. Thank you.
Thank you, Say. Pauline will give us a quick brief on the program structure and also some house rules. Pauline?
Thank you very much. I would like to just give a brief about our program today for the conference. We have 3 sections that we are going to be addressing critical areas when it comes to academic and social collaborations. So we are going to be having cross-disciplinary keynotes, whereby we'll be featuring thought leaders who are going to also support in terms of bridging diverse academic fields. We shall have presentation of papers based on the thematic areas shared by various sessions assisted by the rapporteurs. And in each presentation forum, we shall have 6 sub-themes. That is the education sub-theme, the policy, climate and environment. We shall have indigenous studies. We shall have infectious diseases and non-communicable diseases. So we shall be beginning with keynote presentation. We shall have 3 keynote presentations. And the first one will be delivered by Dr. Abi Odshon based on the program that we have provided. And then for the morning sessions, that is for the case of Eastern time. And now for the next 3 hours, we are going to be having education and policy presentations. We shall have presentations from climate and environment and also from the indigenous studies. And then this will be followed by a second keynote that will be the lunchtime keynote. That is going to be delivered by Daniel Kubey, who's going to deliver a keynote on indigenous land rights and the intersections with health research in Africa. And then we shall have afternoon sessions where we are going to be having a round table by the Africa Institute Canada Africa Young Scholars Coalition, the CAACC. After that, we shall have presentations from the infectious diseases sub-theme and non-communicable diseases sub-theme. After that, we shall have a closing keynote which is going to be delivered by Dr. Hesham Gaffar. And this comprehensive program is going to just reflect on our vital roles and also on our academic collaborations in addressing global challenges and fostering impactful partnerships. Thank you very much, and over to you.
Thank you, Pauline. Back to you, Saverio. I just want to check whether the president has logged on.
Melanie, it's Nancy Stewart here, Alan's Chief of Staff in the Office of the President, and I'm stepping in for him whenever you're ready.
So back over to you, Saverio.
Okay. Good morning again. So now I have the privilege to introduce Dr. Alan Shepard, who is the Western 11th President and Vice Chancellor. I will just say a few words about his biography. I could spend, a much longer time, but I will try to be concise. Inspired by his own experience as a first-generation student, Alan is committed to an inclusive model of education, a multidisciplinary approach to research focused on the public good and solving global challenges. In terms of his background, Alan's senior leadership experience includes terms as a provost at Ryerson University, which is now Toronto Metropolitan University, and as a president at Montreal Concordia University. He currently serves as a member of the Council of Ontario College of Social Workers and Social Service Workers. He was the chair of the Council of Ontario University between 2022-2024. He's also the past chair of the Canadian Knowledge Resource Network, past vice chair of the EU15 group of Canadian Research University, and has served with numerous organizations devoted to the arts, healthcare, philanthropy, and business in Montreal, Toronto, London, and US. Shepard also received an honorary Doctor of Laws from Ontario Tech University recently in 2024 in recognition of his leadership and promotion of transformational changes and innovation in higher education and his advocacy work on diversity, inclusion, and belonging. So, Alan, I'm not sure if you are with us, but I will be pleased.
Saverio, it's Nancy Stewart joining on behalf of Alan Shepard.
Okay.
Yes, but I'm so pleased that you took the time to do the introduction for Alan, as he is so disappointed to not be able to be here with us and you this morning. His call to me, as he was called into an urgent situation as Chief of Staff, sometimes there are things that I'm asked to step into, and I was honored to do this. He said, please don't simply send my regrets. Please go and share some of the comments that I wish to share that he had planned to speak to this morning. So I'll spend just a few minutes doing an abbreviated version of some of the comments that he had put together and wanted to share in particular to this group. So very warm greetings on behalf of Western University. Alan put in his notes very specifically that he wanted to thank Pauline and Seyram for co-chairing this inaugural conference. And what his notes certainly reinforces that we live in really remarkable times. And of course, technology makes it easy for us to be able to connect over vast differences in many time zones. So no matter where you are or what time it is, for some of you, it may be very early, very late. Thank you for joining. At Western, it's a really important time to be able to think about global collaboration and partnership. And often our role as students and scholars is to provide optimism and provide hope to be able to prove how much can be accomplished when we learn from each other and when we work together. Our goal here at Western University is to expand our global engagement through really respectful and equal partnerships. And we're really proud to say that our colleagues at the Africa Institute and beyond have been actively engaged in doing just that. So it's really exciting to see how many partners are attending today's conference who also have the same goals and who have the same interests. So just a couple notes for context. In November of 2024, the Canadian government made a new investment of $54 million for flagship initiatives in partnership with African countries, focused on peace, security, economic development, and enhancing diplomatic activity. As part of that announcement, the Honorable Ahmed Hussein, Minister of International Development, said, as equal partners working to address global challenges, Canada and Africa are committed to building a better future for all our citizens. So I think for many of you who have decided to join today, who are present at this conference, we're doing just that, working together to be able to change lives. And whether you work in health sciences, engineering, economic development, arts and humanities, no matter what your field, your work is important. As you likely know, the Canadian government has made changes to study permit application process. And this has created, unfortunately, a lot of confusion for students and for parents and others. And so as senior leaders at Western, we have an important message to share, which is that the doors to Canada's great universities are still very much open. And Western in particular is ready to welcome and support its international students. We have been really intentionally and ethically welcoming international students to ensure that they're fully supported academically and socially for many years. We're really proud to have a large population of students and alumni from African nations. Just in about a month's time, Alan Shepard will be leading a delegation to Kenya, Uganda, and Tanzania. And I'm also part of that group that's organizing that. Very exciting to be exploring partnerships in the region. This is a huge focus of our work that we are considering to be in that category of hope and optimism. We're really enjoying the planning that is heavily underway for that trip. So with that, I will close in thanking all of you for being here, for coming together and learning and exploring together, and look forward to hearing how this experience goes. Thanks so much.
Saverio, you're muted.
Yes, I think, who is next? Melanie. I think
So
the agenda.
we will continue with the program. And the next person to come on is Dr. Funa Moyo to manage the keynote.
Good morning, everyone. I hope you can hear me, Melanie.
Yes, we can.
Thank you. My role is to present to you our distinguished guest, keynote guest speaker, Dr. A.B. Adishan from the University of Western Canada. Dr. A.B. is an associate professor and acting associate dean, research in the Faculty of Health Sciences at the Western University. He is a community health nurse by profession, having qualified to attain a PhD. His research focuses on prevention and ending homelessness, both locally and internationally. Dr. Addison is the managing editor of the International Journal of the Homelessness, and currently he is part of a Kenya and Canada collaborative project, which explores peer support to reduce HIV among street-involved youth. He is a distinguished scholar, as well as a person with vast knowledge on community health. I present Dr. Adishan. Thank you.
Well, thank you for that introduction. And thank you everyone for being here this morning, this afternoon, this evening, whatever time it is where you are. It's such an honor to be a part of this conversation today and to welcome us into reflection and dialogue and learning. You know, being invited to do this talk, I want to acknowledge that there are others who have spent longer careers in Africa-Canada collaboration. There are others with more partners, more projects, and more trips than myself. So I want to thank you for giving me this time and recognizing that there are many folks with deep wisdom of this area, and our project, our collaboration with Kenya has been a wonderful experience. But I only bring one perspective to this work. And the other thing in saying that, I want to recognize my own positionality as a Canadian, as a scholar working in the global north. I want to recognize the sort of several privileges that come from being an academic, and from being an academic in an institution like Western University, one of the top 15 research-intensive universities in Canada, and the opportunities and privileges that come from being located here, and from the many good fortunes and aspects of sort of luck that have positioned me where I am in this world, and have given me opportunities that I know others are not necessarily always afforded. So again, thank you for giving me space to share and to think out loud with you this morning. So I wanted to start a bit of my reflection by telling you a little story about my own PhD work and an experience in my dissertation examination. And so my PhD work, I'm a nurse by background, and I worked in community, including with a clinic for people who were homeless or street involved. And I was really concerned about the way that people experiencing homelessness were being treated within the healthcare system, including within my own organization. And so, you know, I saw the sort of discriminations, I saw the barriers that health providers were putting up in that work. And so my work was a very qualitative piece to understand how the sort of power within those relationships are navigated and negotiated, and how people experiencing homelessness try to assert themselves and try to build their own value and power within some very disempowering healthcare contexts. And so I was able to sort of highlight those concerns, and look at the sort of ways that our health system was structured that created these sort of multiple inequities. And part of this was explaining why people experiencing homelessness in Canada are dying often 30 years younger than other Canadians. And a big part of that, unfortunately, in the context of having a public system of healthcare, is the way that they're treated in that system and pushed out of access. So that was the context in which I was coming into my examination of my dissertation. And so, you know, you're coming in, for those who've done a master's or a PhD thesis, you're anxious in that examination. You're feeling insecure and unsure about the quality of your work. And you try to sort of anticipate the questions that you will receive, and the sort of, you know, focus on maybe your methods. Did you pick the right methods? Did you talk to enough people? Those sorts of things. And one of the first questions asked by one of the examiners, who I didn't know, he opens with, so tell me, and again, I'm expecting like methods questions. He says, tell me, are you an activist or an academic? And I thought, oh my, that was not what I was expecting to be asked, because my paper, it raised some very sort of critical social questions, and it really demanded of our systems and our policies to consider equity in new and different ways. And it really called out the structures within organizations that disempower people. And Unfortunately, I kind of knew the answer that he was looking for, and it wasn't the answer necessarily that I was ready to give. And I think the correct answer was he wanted me to say that I'm an academic. And what struck me about that as I went away from that, I did pass, I did get my PhD. But as I went away from that experience, I reflected on what the question meant, where that came from, and really the implications of the question was that academics should be maybe objectively sort of disconnected in some ways from sort of more sort of political or policy positions, that we should simply be sort of presenting data and letting others decide the implications of that data, and that we should sort of beware of subjectivity, beware of sort of bringing too much of our own ideas to that work. And that didn't sit entirely well with me. Part of it was from my training, within the School of Nursing here at Western. We really do think about inequities, structural inequality, structural violence. And so I was trained to consider both the sort of subjective and objective aspects of our work. But saw with that within academia, we are still experiencing pressures to just be sort of objective scientists and closed off from some of the more subjective discussions. So what I wanted to share with you this morning, and why I've titled my discussion today around not just passion but also compassion being what brings us together, I think, in transcontinental research, is because I want to actually invite us and give us permission to be compassionate. Because passion is pretty easy. As researchers, as educators, as academics, I think we're all passionate about our work. It's busy work, it's consuming work, and so I don't think any of us would be this far if we were not passionate. And it's easy to say we're passionate about our research, we're passionate about our teaching. But academia as a system can be skeptical, I think, of compassion, because compassion suggests subjectivity. It suggests that there might be other sort of values we bring into spaces beyond the data, and that we might be sort of screening the data through the lens of values, values such as human rights. And what I would like to invite us to think about is that the reason why we have so much successful Africa-Canada collaboration already is because we find our shared humanity in our spaces of compassion. And that the vast distances in both geography and sometimes in policy and resources, those differences are easily bridged when we lean into our compassion. And so that's what I hope you hear from my brief conversation this morning, is that it is compassion that will continue to bring us together, that will give success to our work, that will help us bridge the complexities of this type of work as well. So I wanted to just give you a brief snapshot of our project. I'm going to be sharing about that a bit later anyway, in terms of the data. So I just wanted to set a bit of context to give an example of how compassion has brought us together. And so the project that we've been involved in is looking at HIV rates amongst youth, and particularly street-connected youth. This was particularly relevant to me as a nurse in Canada who's worked in community health, because we have seen very good outcomes in terms of both prevention and treatment of HIV. But there are a couple populations within Canada that we continue to see high rates of new cases. And one of those populations are people who use injection drugs. The other is street-connected youth. And it's probably not surprising because when you think about youth and you think about sexual health and sexual health education, it's already a population with some complexities and particular skills required. And then when you think about youth who are living vulnerable in the street, maybe using drugs, maybe being trafficked or involved in prostitution, don't have stable access to housing and healthcare, of course, the risk goes up that much further. And so this was a population, as someone who looks at homelessness, generally, this was a subpopulation that I was particularly concerned in terms of their health needs. And so we were pleased to learn about and be brought into a pilot project that had been running out of Eldoret in Kenya. And they tapped into the concept of peers, P-E-E-R, peers. So those who have lived or living experience of being on the streets as a youth, have lived or living experience of HIV, who can bring their particular wisdom of that lived experience and also be in a position where maybe the dialogue between themselves and a youth on the street is going to be more effective than, me as the middle-aged, privileged nurse trying to talk to a street-involved youth about their lives, and can be more impactful in that way. And they've been having good success already with the pilot in Kenya. And we're now had resources to expand that across multiple sites in both Kenya and Canada. And so that project has been amazing, and it's been complicated, and it's been fascinating and joyful, and it's been frustrating. But what has carried us through is that we have that shared compassion for youth who are marginalized in our communities. And so whether that's in Eldoret or Haruma, whether that's in Toronto or Vancouver or London, we all have that compassion. And whenever the complexities of the details of doing this work come in, we come back to our space of the values that bring us into this work, and that this work is meaningful enough that we're going to continue to work our way through it together. And so I've mentioned that transcontinental research and teaching partnerships, academic work is not simple. And I want to acknowledge the very real challenges that we face. And I want to invite those who are newer to the work, not to sort of be naive to the challenges, and recognize that there are differences, there are requirements that make this work complex in certain ways. For example, like even in this conference, as Saverio opened us, it would be lovely to be in person together. And there is value in being in person in spaces, in the way that even conversations occur. But of course, in person across an ocean is difficult. It's expensive. It's time consuming. And our colleagues from Africa often face very frustrating barriers from our governments in terms of visa applications, or in more formalized partnerships if study and work permits are needed. The very real discriminations we see in people's visas being declined, who are renowned professors in Africa. Of course, there's like the formal parts of partnering. There's the agreements. There's needing our institutions, often at the various highest levels, to sign off on things, and legal agreements that may be required. We know that we're very often sitting and waiting for a response from our senior administration to sign off on something. And so that's an additional complexity. There's also the incredible high teaching loads that our colleagues in Africa often have, leaving them so very little space for research or academic collaborations, having to always happen off the side of the desk in their free time, and because of the time difference, very often in their family time. And we know that that's not fair, and that's a huge burden on our colleagues in Africa. We also know in terms of the Canadian side that Canadian researchers are expected to have many, many projects underway at the same time. Because of the sort of productivity requirement, it means that we can't invest our whole selves in the time and energy that these partnerships take, because we need to be having many projects running simultaneously. We know funders can be very skeptical around international projects, where funding organizations are often developed by national governments who have the requirement to sort of show the impact of their money on the local country. And they can, in the same way, be very restrictive of how money flows internationally, if it can at all. And that makes it very hard for resources to be in the right place. We also know that where data lives can be complex, and that data transfer is complex on an international context, and that folks have right to have their own data, and at the same time, we need data wherever the analysis is going to be taking place. We also know that ethics is very complicated in these projects. We know that ethics committees can be very, again, sort of skeptical or concerned about our work, which is good. It's good that we do ethical work, but often the requirements that are put in place maybe do not parallel the same requirements and expectations of our local work. And then there's also the duplication of processes or multiple processes if there are multiple organizations, which again, it's good that ethics is approved at all sites, but this does add time, very real time, to the work. And so one sort of small example of this sort of skepticism is an audit that one of my PhD students experienced, a financial audit. She was doing research in her home country in Africa as part of her PhD, and the pandemic occurred, and so she wasn't able to go herself to that country and do the work, and so she had to hire expert researchers and transfer the funds to them to do the data collection. There was a financial audit generated by Western University because money was going overseas without direct supervision, which again, it's good that we keep an eye on the resources, that they're used wisely. However, the way that the questions were framed was deeply concerning to me, and what I felt and I heard was very high disrespect of exceptional researchers in the country where this was occurring by the financial auditors who, it wasn't enough to say that this person is a full professor with dozens and dozens of their own publications. We're confident that they are administering this project properly. Whereas you would never have those questions asked in that way of our colleagues in Canada. So there are very real practical and pragmatic challenges that we face in transcontinental work. So then, why bother? If I've just told you all the challenging things, it's not to discourage you. It's to invite you that there are very real and practical things that it's important for you to know about and to work through. So why bother? Well, we bother because this is human work, research, academia, teaching. It's human relation, it's collaboration, and it's seeing and finding and expressing our shared humanity. And I would say that one of the aspects of that shared humanity that draws us together continuously is compassion. And so for me, it's compassion around those facing risk of communicable diseases and poverty. But I've looked through our agenda for today, and I see so many amazing points of compassion. Compassion for those facing chronic diseases, compassion for those facing food insecurities, compassion for children with barriers to their learning, compassion for those impacted by climate change, those impacted by bullying, those impacted by war. I look forward to hearing these voices of compassion this morning and this afternoon. And I would suggest that what we will hear is great teaching, great academics, and great research and science. And none of that today will be separated from compassion. And we don't need to separate ourselves and our values from our work. In fact, I say quite the opposite. And I think this is important because I think we're living in a very bad moment globally, particularly what's happening in the US in terms of what was a drift and now is a rapid charge towards fascism, is going to have a huge impact globally. And I fear that other countries may follow this path. Because a big part of fascism is nationalism. And I was so grieved to hear about the freeze to US aid with the future plan to cut 90% of US aid. That is an immediate, horrifying impact globally. But part of this and behind it as well is this anti-science discourse. And the anti-science discourse will lead to freezing on funding, and will lead to a retraction on things like human rights. For myself, it's concern about the right to shelter, but we're already seeing an attack on the rights of women, for example, including what's funded as both research and as aid. We know that US funded projects are now going to be investigated for certain terms that the current administration is opposed to. And we know that many collaborative research projects include those terms, because those projects might include things like health equity, might include things like the rights of women and children, might include things like considering inequities in access to education. And so our research will become targets of the US government. So I think we're in a dangerous time where we can also risk looking inwards. So as Canada is facing an attack by our neighbors on the south right now, a political attack, it's easy for us to be distracted by our own economic survival and forget about others. However, I think in the context of this sort of nationalistic skepticism, that our values, again, is what will save us in this moment. I don't think what's going to save us is having really strong p-values, having adequate sample sizes, having matched control groups. Yes, we need all of those things, and that is part of doing our good science. But in terms of what's going to save our work on the global sphere, is it will be our human impact. It will be how our work advances development, human development, economic development, environmental development. And it will be how we express our mutual benefits and the bilateral value of our work. And I think that bilateral is so vital and becomes even more vital in an age of skepticism. Because one of the things that we have failed at in the past in research is the perception that knowledge moves from the global north to the global south. And that's a prejudice that underlies academia at times. But like our project started with a pilot in Africa from which we learned and from which we developed new successful programs in Canada, knowledge needs to move both ways. And in the Canadian context, as we can speak to the value of knowledge we've gained from Africa, that allows our funders to continue to value putting money into these types of collaborative projects. So when we think about the barriers to collaborative research, the barriers we probably most often name are time and money. However, I think that there's a deeper barrier than that, and I think that barrier is will. So it's the will of funders to support international work. It's the will of academics to do things that are sometimes harder. It's the will of our administrators to sign off on collaborations. And ultimately, it's the will of the public that our politicians should be following to say that our space in the world is valued by not the borders of our country, but is valued by our collaborations across all borders. So I think the shift we will continue to need to do is to lead people by their hearts, not necessarily by their heads. And that can be harder for us as academics because we are thinking people. But we need to expand our resources and our skill sets to also think of ourselves not just as educators and teachers, not just as researchers and scientists, but also to think of ourselves as storytellers, because that's how we'll reach the hearts of decision makers and the public. So tapping into our current focus on open science, it's not just having open access publications, but I think we need to put our work online. We need to put websites up about our projects. We need to build stories into those projects. We need to make sure that impact is centered in the stories we tell about this work. How is this helping people? How is this helping the economy? How is this helping the environment? And not to make academic publication the sole priority or even the lead priority. And also that means building time to meet with decision makers to tell our stories of our work. So again, thinking back to our own project and the idea of having young peers support those at street level. Our project goal was, of course, just to evaluate the effectiveness of this model. However, in the Canadian site, particularly the site in London, we had an even better success than that, which was that our peer navigator, who had been funded by the project working in our public health department, was offered a permanent full-time position within the department at the end of the project. And that was because our public health department saw that she was able to achieve something that those without that lived experience of homelessness and HIV were not able to achieve in terms of engaging youth at street level. And they saw that by the stories that we told. So we didn't give them a spreadsheet of data and graphs. Instead, we told them the story of the work and the impact and shared actual voices and quotes from the young people who she had helped. Because you can imagine her connecting with a youth at street level who's maybe a young mom, 17 years old. She's trying to ensure her child is not taken away by child protection. She's trying to find stable housing while she's also sick. While she is just barely maintaining her sobriety. Well, she has a mom who is predatory of her in terms of her money and is always trying to get access to her daughter's money. And navigating that person into a point of stability where they can also take care of their health and their health needs is a monumental task, but a vital one to support the most vulnerable. And so that story hit the heart of our public health department and allowed them to find the resources to make the position permanent. So in conclusion, I want to recognize that the work is complex. I want to recognize that the current environment is a very difficult environment to value and to promote international work and to recognize things beyond our own borders. But I think we can still be successful in this work and even more successful than ever. And I think our pathway to doing so is to welcome ourselves to lean into compassion, to lean into our values, and to not solely attempt to be disconnected, objective scientists and educators, but instead to be people of compassion, working together on the shared things that touch our hearts. Thank you very much, and I welcome your conversation and your questions.
Thank you, Dr. B. Thank you for an inspiring presentation. Right. Are there any questions so that we can give him the chance to respond?
There is a hand up by Saverio Stranges.
Yes, Prof.
Thank you very much, Abe, for your beautiful presentation. So I concur with all the points you made. And one general comment also about building partnerships between, the global north and the global south. As I mentioned before, we were recently in Morocco, Casablanca, and obviously, as you are aware, many of these African countries are experiencing a very rapid development. And so I always reiterate the message: there are multiple lessons to be learned from for the global north, from settings like African countries. And so I always advocate to move away from the Western, I'm talking about Western countries, sometimes arrogant attitude of capacity building, that we are the ones that set the gold standard, and even way we do research when we focus on global south, and therefore we need to design or build partnerships which are truly bi-directional and mutually respectful, with a humble attitude in terms of, and this applies to all kinds of partnerships, but even in terms of the funding opportunities, I see not just within the Canadian context, but also in other Western countries, I still see that underlying arrogance of the capacity building attitude, which in my view does not really reflect what is happening globally. So I would like you to make a comment on that, and how can we mitigate or reshape relationships in a way that is truly mutually beneficial.
Mm-hmm. Yes, thank you for that question, and you make a very good point around. I like the term arrogance. I think that's a very good way to frame what we have seen and continue to see often. And I think that arrogance shows up, for example, in funding guidelines and sometimes undue expectations put on folks who are not Canadian, for example, for Canadian funding. I would say the one real opportunity comes from what is best practice within any sort of community collaborative research. And that's kind of backing up from where we often start in the global north on research or academic collaboration, which is we often start with the question or the topic or the academic program already in mind, right? So very easy for me to say, you know, we are thinking about how you integrate mental health supports into housing services. Who wants to be a part of this work? Who can we reach out to? Which is sometimes the reality of the finding the funding is you start with an idea. I think best practices will always be, and whether this is working in a community in your own context or working across borders, is to ask, you know, what is the question? What is the need? What is the priority? What is the hope? And to start from that more open space rather than already folks from the global north bringing the topic and saying, who wants to work on this with us? That can be, you know, it can involve a longer timeline, right? To say, okay, we've had this great collaboration. For example, the School of Nursing has been working with Rwanda for many years in many different ways. To ask our colleagues in Rwanda, what do you want to work on now? What questions do you have? How can we, what are some commonalities and sort of starting from zero on our collaboration. So I think that's one way we can get away from the arrogance, is to not sort of already presume the topic, the research question, or the academic program before the conversation has started.
Thank you very much. I see a comment also from Opioyo Loyan. It's nice to see Opioyo with us today. Opioyo, would you like to introduce yourself? And we're honored to have you with us today, and please.
Thank you, Saverio, and good morning, everyone. Thank you, Abe, for such a beautiful presentation. I am at this moment at Western University. I'm the Associate Vice President of EDI. Western has worked very, very hard to, as Nancy Stewart mentioned at the top of at the start of the program, to really connect with Africa. And I think that there are many efforts, you know, being pushed right now that I think will bear fruits. That will bring our researchers at Western and researchers in Africa together. And my question to you, Abe, you know, I really was struck by the notion of storytelling. I really believe in the power of storytelling as a way to signal what we are doing, as a way to make, you know, make voices that will not otherwise be heard to be heard. So when you think about storytelling in our context, let's say at Western here, how can we amplify storytelling? Where do we tell those stories? And how do we tell those stories so that decision makers, so that leaders, so that the community is aware of the work that is being done in the field?
Mm-hmm. Yeah, well, thank you for the kind words as well as the really good question. So I reflect on a conversation I just had yesterday with one of my PhD students, and she's from Nigeria, and she's looking at the experience of women with children in both Canada and in Nigeria when they experience homelessness and are then separated from their children. And that could be separation by choice, where they put the children into maybe a safer or more stable space, or may be separation against their choice, for example, when children are taken by welfare services. And she said to me, and she is you know, she's living the burden of these stories at this moment in time and wrestling with that. And she said to me, As soon as I am done my dissertation, and I've passed, I need to do something else like documentary uh, with these women, because she's in her dissertation, she's taking the stories they've told and she's writing them out, and she's chopping out little pieces of those stories and putting them into a manuscript. And she's already recognizing that that isn't enough, and that the voices, the faces, the completeness of the stories of the women is what's needed for change, to say what we're doing isn't good enough. Um, so that's simply to reiterate that value, that academic work serves one role, but it's not the only role. Where this exists within organizations, I think, is really an invitation for collaboration. And so we have in our universities students whose study is storytelling, whose study is documentary, whose study is photography, whose study is biography and autobiography. And I think where we can do this is also not just reaching across the ocean, but reaching across departments, to say, if we're doing a project, what sort of different expertise are we inviting into that project? And as a nurse, I'm never going to be a documentary film maker. But at Moy University, there's probably students who can do a wonderful job, or faculty who can do a wonderful job in that area. So yeah, I would say it already exists, the skills, the expertise, and that we should think about, when we're putting our projects together, really widening the realms of sciences and social sciences, and bringing them together.
Thank you. There's a hand. Masa?
Yes, please. Can you hear me?
Yes, thank you.
Yeah, thank you very much, Abe, for that wonderful reflection. And it really spoke to that position or expression of compassion for the work that we do. I just have a question around something that you mentioned about some of the challenges with the global partnerships. And you mentioned about time, funding, but you also highlighted issues of discrimination. So my question there is, with you being a Canadian, having expressed your positionality right from the beginning, what are some of the roles or steps you are taking to really advocate in that regard to address those challenges?
Mm-hmm. Yeah, thank you. Yeah, and this positioning myself in the work comes from a guideline that we have collaboratively developed at Western University around equitable engagement. And one of the principles is that folks look into themselves and recognize their positionality. So in terms of the practical work that I'm doing, I do have a bit of a benefit in that I'm in the acting associate dean research role at this moment in time, which allows me to speak a bit more directly to some of the decision makers. And so I would say the biggest piece of discrimination that I'm working on right now is around funding. And particularly two areas. One is around our international students. And so in the Canadian context, many of our largest graduate funding programs are restricted only to domestic students. And so I've been part of an advocacy to open those funding programs. And we do have indication of that direction. Now, we'll see if it's a sort of a wide open, or if it's like a select number of, which is how these things often start. So that's one. And then the second is for funding in general. So across the spectrum of our programs, we have sort of more or less availability to do direct fund transfers to other international partners. And so I've been advocating that more of our programs follow what I consider the best practices, which is that monies can be transferred to other institutions and don't all have to be administered out of Western. So those are the two things that I'm personally working on at this moment.
Thank you, Dr. Shan. There's a hand from John. Go ahead, sir.
Yeah, thank you so much, Professor, and I congratulate Professor Abe for the good presentation has given to us. As someone who is community health based, tackling the issues from the community, and for sure for the good results you have get since you did your PhD, and from what you have also done in the past as scholars, don't you think that the issue also could be related about the issue on challenges could be also related to the brain drain? Because if you collaborate with the African students trained in the Western University, so then they can't go back to sell back what they have got from the research they have done, nor the university could not understand very well out of the PhDs or the publication they have made, the impact on the population or the community. Don't you think that there will be always a barrier to a good collaboration from the global north and the global south, whereas now people are saying, oh, because we are having brain drain, let us build on the global south-south collaboration and we leave the north. So this is also a dislocation of the achievement you have had as a scientist, and from what you are saying, that was something I wanted you to hear from.
Yeah. Yes, thank you for that important point. And I absolutely do acknowledge that. And I acknowledge that I participate in that. So I have several students from Ghana, Rwanda, Nigeria, working with me, and many of those students do remain in Canada after their studies. And I recognize that that is part of the brain drain, and that's just myself, and that we as a whole system contribute to that. Very real problem. Yes, I do. I recognize, I acknowledge it. I don't personally have the solution for this. One small thing that we've done as a School of Nursing in our partnership with Rwanda is that we've worked with the University of Rwanda School of Nursing so that they've developed their own baccalaureate, master's, and subsequently PhD program. So that's the contribution back, is that they're able to develop their own students rather than sending students here to work with us. So that's one small way to mitigate it, but no, it is a very real challenge. We are part of that challenge, and I acknowledge that.
Thank you so much. I appreciate.
Thank you. There's one question from Kandala. Go ahead, sir.
Yeah, good morning, good afternoon. I will concur also with the remark from the previous colleagues for a wonderful presentation from Abe. So I'm Kandala, I'm based at Western. So I just wanted to ask a question to Abe. How will you think that the notion you brought forward for compassion, this translate very well in nursing, in your experience, how this can be achieve across academia, context of Canada, for example, engineering, in politics, and so on. So that is what really perhaps is a new concept and a new way of going forward for science. So so I just wanted to ask that first question, and then the second question is the place, what is the role of academia really in the context of the North? Having maybe stay outside Africa for a long time, so I found it very difficult to see that, for example, in terms of collaboration, the academia is always the government. We talked about arrogance, about policy on visa, and so on funding is always the government. And the academia, what is the role of academia in terms, how can the academia also influence the what is going on in terms of the government? So those are two questions that I wanted to ask. Over to you, Abby. Thank you.
Yeah, yeah. Well, thanks. Well, I will answer the first one, although neither are easy. That I think that's a bit of an easier question. In terms of like, so thinking about compassion, and I was thinking about this as I was preparing my remarks. I was actually thinking about engineering, and I said to myself, you know, if someone is at this conference because they create a really good water pipe and their research is helping with water infrastructure, and they're an engineer and they make a good water pipe, am I talking about compassion? Is it going to have any meaning for them and their work? And I think it can, and I think that it's actually not a bad thing for us to invite all scientists to say, what is the impact and meaning of my work to humanity? You know, the more bench science, the maybe more sort of steps along a path that question are required. But I think it is good for us to ask that of ourselves. And for example, I know our colleagues in neuroscience have invited all the folks working in that area to ask themselves that. No matter how much of a sort of cellular level you're working at, is ask yourself, what is the human impact of my work? So I think once we can answer that question, then it helps us find, so then where does that root us in compassion? If we think that our work several steps down the line perhaps can make lives better for people. Your second question was sort of, how can we in academia better speak to government, direct or fix broken policies? I mean, I think this falls outside the realm of any singular institution. This is where I think collaborations in Canada, like the U15 collaboration, is where we can have sort of common messages together to say, look, this funding is problematic for global work. This policy is problematic for global work. So I think that's how we will shift government, is by many institutions having the same message up to the decision makers. And sorry, I do see other questions, but I want to check in with our chairs because I think our time may be past.
Yes, Abe, thank you. Would you like to say some last words and then we move on to?
I just thank everyone for their time. I know getting online is sometimes a little harder when we have so many things we have to do in a day. So thank you for being with us today.
Thank you.
Thank you, Abby. Over to you, Melanie.
Actually, it's over to Dr. Gervais Ndayizeye.
Sorry. Over to you, Dr. Gervais.
Thank you very much for this opportunity. My name is Dr. Gervais Ndayizeye from Inter-University Council for East African Community. We do coordinate all universities within 8 countries. Our mandate is to advise them. However, My role today is to chair some presentations of 4 people who are going to make presentations. Our time is very limited, but if I just comment from what Abby said, he started by saying compassion. Yes, compassion, it's a process of learning where you can get knowledge. Whatever you can do without compassion will not be successful. Hence, education, it's only about compassion in a way we can impact human capital. Hence, the 4 people we have, number 1 is Omolo Olbi, number 2 is Shifa Khalid, number 3 is Barack Okeo, and number 4 is Petronila Mutinda King. For the sake of time, I will be requesting every person who's going to present to use a maximum of 7 minutes so that we can reserve 3 minutes at the end of 4 presentations where people will be able to ask some questions. And so let me call number 1, Omolo, who is based at West University, Canada. The theme of her presentation is 2 nations, 1 learning space, lessons from the design, implementation, and evaluation of Nigeria, Canada, global classroom case study. Omolo, the stage is yours. 7 minutes. Thank you. We can't hear what she's saying if she has started presentation.
Oh, sorry. Hello, everyone.
Hi, we can hear you.
Yeah, I was muted. Yeah, so I'm going to be giving a presentation on the paper titled 2 Nations, 1 Learning Space, Lessons from the Design, Implementation, and Evaluation of a Nigerian Canada Global Classroom Case Study. So briefly, we're going to be looking at the design and the components of the global classroom. We'll also take a look at the evaluation process and the findings from the global classroom, and we'll be giving our conclusion and also acknowledgement of key stakeholders that were involved in the global classroom. So in today's world, which is actually characterized by global connectivity and technological progress, and where we have the traditional teaching methods where the teacher assumes the role of instructor, decision makers, and classroom manager, are actually giving away to alternative methods that actually encourage student-centered learning approaches. And moreover, the 21st century also offers an ideal environment for students globally to actually experience transformative education through initiatives like the global classroom. Now, in simple terms, the global classroom is a learning environment that connects students and instructors from different countries using technology to collaborate, share ideas, and also to gain international perspectives. So in the fall of 2021, we actually designed and implemented a global classroom for upper year undergraduate students at the University of Toronto in Canada and the University of Ibadan in Nigeria. So this slide shows a figure that illustrates the overview of the global classroom design. The global classroom design was actually implemented through a formal partnership. So we have the University of Toronto in Canada and University of Ibadan. I also had a partnership with the African Center for Innovation and Leadership Development in Abuja, Nigeria. So the African Center actually facilitated the partnership with the 8 middle schools across Abuja. So we had like 8 middle schools, and in each of the schools, we had nutritional representatives. So students from University of Toronto and University of Ibadan, we actually grouped into blended teams. So we grouped into 8 blended teams, and we assigned to each middle schools, and each nutritional representative was assigned to the student. So this figure also shows the global classroom schematic. Now, so throughout the global classroom, students actually engaged in various collaborative activities with their peers and also with the nutritional representatives from their assigned class, from their assigned middle schools. So at first we had an online joint lecture that was actually held via Zoom. So during the session, the course instructor provided lectures about nutrition transition, which provided background information for the student. And it was also an avenue for the student to actually get to meet each other and also introduce each other and know their group members. And they were grouped into blended groups. So what I mean by blended group is we had both students from University of Toronto and University of Ibadan in the group. So in each blended group, they actually work closely with a nutritional representative from their assigned middle schools. So the nutritional representative actually created a 10-minute video, and these videos were actually shared with the students. So in this video, they just briefly provide background information about the school and also into existing nutritional programs they have in the school, and the challenges and the difficulties, the nutritional challenges and difficulties they're actually facing in the school. And also students also had a 1-hour interview session with the nutritional representative. So for this session, based on the video they actually watched, they actually had a time to actually ask the representative questions to actually deepen their understanding of the nutritional issues at their assigned school. And finally, so they were tasked with presenting a project proposal. So they were assumed to have a budget of $25,000. So with that, they were to design an intervention that actually aimed at addressing specific challenges at their assigned middle school. Now, so at the end of the call, at the end of the global classroom, we actually gathered student feedback through survey just to evaluate the impact and the effectiveness of the global classroom. So result from the Likert scale shows that about 66.7% of students from University of Toronto and about 61% of students from University of Ibadan actually strongly agree that the experience was actually engaging and insightful. And also, we have about 55.6% of students from the University of Toronto and 72.2% of students from the University of Ibadan also strongly agree that the experience gained could actually be applied to their future careers. So aside from the Likert scale, we also receive written feedback from the students about their experiences. So specifically, one student mentioned, my experience with this course remains positive. I got to learn a lot of things and I experienced new things as well. By working with students who were in Nigeria, I got to also learn a lot from them. It allowed me to understand different perspectives and opinion with respect to Nigeria's culture. I love the interviews with the school principal. She was a nutritional lead and she was nothing but pleasant, and also understanding of our question was open to all the questions we had for her. Then another student mentioned, it was an insightful experience that built my teamwork spirit and made me think of practical ways of applying my nutritional knowledge. And lastly, a student stated, well, my experience with the global classroom was cool, but would have been nice if this classroom was done preferably weekend and provision of data to the project. That's all for me. So based on our experience from the global classroom, we actually outlined 6 key lessons that can offer valuable insights for educators, policymakers, and curriculum developers that actually aim to globalize undergraduate education and also enhance cultural competence. So the first lesson is different time zones and institution calendar differences can actually derail the global classroom if not adequately accounted for and planned ahead. And also poor technological devices, infrastructures, and unreliable internet connectivity can result in unequal and ineffective participation in the global classroom. And lesson 3 is the discussion forum, presentation of proposals, and interviews with stakeholders actually enhance interaction and communication skills. So we need to have like collaborative activities and engagement activities. Then lesson 4 talks about grouping students in blended teams like we did in our global classroom, allow students to gain insight into each other's culture and appreciate cultural differences. And lesson 4 is emphasized about communication. So ineffective communication among students can actually result in conflicts and misunderstanding in the global classroom. And the 6th lesson, which is the last lesson, is the project-based learning approach, which we adopted, can actually allow students to gain practical experience in real-life situations. So in conclusion, There are other activities we actually integrated in our global classroom, which include the lecture, the discussion forum, and also the proposal presentation, actually facilitated active participation. It increased student engagement and also equipped students with valuable skills that are actually necessary to succeed in the real-world challenges. And we've also outlined key lessons, 6 key lessons that can be helpful tools for instructors, course designers, and policymakers. We also like to acknowledge Dr. Ariyo from the University of Ibadan and Selena from the University of Toronto, then Ms. Tina from the African Center for Innovation and Leadership Development, and we have Dr. Obidi Ezizika from the Global Health Innovation Lab and Western University. And lastly, we want to say thank you to all our nutritional representatives from all our partner schools in Abuja, Nigeria. Thank you for listening.
Thank you very much, Omoro, for just using 8 minutes. So you went one ahead. It's okay. Let us go. We are going to ask questions at the end of the full presentation. Let us call Shifa Khalid. Shifa Khalid is based in Nairobi, Kenya, at Aga Khan University. The topic is cross-continental experiential learning, strengthening academic ties between Canada universities and the Aga Khan University. Shifa, the time is yours.
Hi, everyone. Good afternoon, good evening, good morning, wherever you are in the world. Just a quick note, I am with the Aga Khan University, but I am personally based in Pakistan. However, I represent the Global Engagement Office, and our team is the one that manages our placements and exchanges between the entire university and all campuses, 3 of which are based in East Africa. In order to begin, I will be talking to you guys today about our cross-continental experiential learning, our experiences, and our takeaways from what we've been doing so far. So the Aga Khan University has always had a very special connection with Canada because of the vision of our first chancellor, His Highness the Aga Khan IV. And because of that, I think most of our institutional partners are also from Canadian from Canada and our Canadian universities. Going forward, and especially based on the talk that we've heard from Abe and the speaking of compassion that we've heard so far, I believe that in these very charged geopolitical times, it's all the more important to have platforms such as these to discuss potential opportunities for experiential learning. We have the following programs with us at AKU. The IIP program is the on-site program that has been in existence since 2008. We've had many students from Africa, from Canada come to our campuses in Africa and take away a lot of wealth of experience. Similarly, we have the virtual internship program and the reciprocal virtual internship program, which is outbound for our students from AKU, both these programs are piloted during COVID-19 when actual physical movement across borders had become difficult. This is the impact that our programs have had so far. We've had 52% of our program students have been from Canadian institutions. We've had a very good representation of women in our programs and placed them in 9 and more Canadian agencies. These are some of the examples of the projects that our students have done. We've had our own AKU student who's done virtual internship with Western University. And then we've also had students from Canadian universities, from Canadian partners who've been with us at AKU. And then we've had the virtual internship as well from University of Toronto, based with our AKU Surgery Department in Kenya. I think it would be just to expand on why we're looking ahead, we want to strengthen these ties further. We want to have a target of having at least 50% of our students from AKU experience some sort of an international experience with Canadian universities and ensure a sustainable, scalable funding process. And now to end my presentation, I would just like to play for you from our intern's own words.
Definitely a different experience. I got to see the side of the early childhood development through that. I got to see a genetics makeup side. I got to see a corporate experience
through my different projects. I was able to, for example, improve my writing communication skills, but also my organization skills.
When I came here, it was such a big culture shock, but I think the moment I actually started to put myself out there, when it came to embracing the culture and meeting new people, trying new things, going new places, I think that's when I had the best time, and I ended up having one of the best summers ever.
It's been super easy to acclimate here because everyone's been so nice and accommodating, and I feel like I've established a new family here.
I really enjoyed just exploring Nairobi and seeing what the city has to offer. I've been doing pottery classes in my free time, learning some Swahili where I can, just exploring different restaurants and activities, so that's been really enjoyable.
You get a very holistic experience here. You go to the cafeteria, because of the amount of people, you'll end up sitting with someone that you don't know and you can talk to them, so you'll understand about diversity. The food you're getting is also from a Pakistani culture, so you're learning a lot about Pakistani culture, but you're also learning how to be a global citizen.
I learned how to make a research project all by myself and all the things that go into it, whether it's trying to figure out what you're going to study, how to do a literature search, trying to determine what literature searches are actually for and how to use them to your advantage, how to optimize different skills.
Working with all these cool machines that exist in a clinical lab, it's so much different than being in just university.
Yeah, I think for me also most of the skills that I've gained have been related to project management, and yeah, kind of going through the proposal and going through all of the research process and stuff, because I don't have a ton of experience with that, so that was cool to learn about.
I can see the development, and now she's at a level she can select research question, she can develop the proposal, and she can conduct the research independently.
When I worked with the people on my team, they were so friendly and they were always willing to help. So it was really great because with that, I got to learn so much. And then also collaboration, I think, was a big one.
Having a whole cohort of interns has been really helpful. I think we've been really there to support one another.
Working together as a team has shown me that we can learn a lot from the people around us, and we're definitely much more capable than we think we are.
I've realized that it doesn't take a whole lot to be working well in a space, a professional space like I am. If you work hard, you can do it.
I'm really glad I did the internship because it showed me what I do want in the future, but it also allowed me to gain a good foundation and a good base knowledge of things so that I can use them in the future as well.
As they exit this program, they're going to be able to go on to their next interviews, their next conversations, not just being able to say, I have project management experience, but actually explaining what that looked like, discussing the challenges they face and the growth and the reflection that was required to navigate those challenges. So they'll be richer as a result of it, and they'll be able to build on top of this experience in their careers.
And that's it from our end for now. If there's any questions, I'd be happy to take them.
Thank you very much for your brief presentation. I would like to remind everybody who is here that the 4 presentations are papers, which means they come out with the abstract to be presented. That's why you have to be keen on this when you're asking questions, so that we are sure that the papers which will be presented will be really able to be published for this case. We go to presenter number 3, Barack Okeyo. He is based in Nairobi, Kenya. And his
yes,
topic...
I hope everyone can hear me well. My internet was a bit unstable.
Yeah, we can hear you.
Nairobi?
Yes. So your topic is the benefits of Canadian-trained Somalia immigrants in rebuilding the war-torn
Yes,
nation.
my topic is benefits of Canadian-trained Somalia immigrants in rebuilding the war-torn nation.
Please, most welcome. You have 7 minutes.
Thank you, sir. To everyone, I'm glad for the opportunity. As it has been mentioned, my name is Barack Okeo. I am a monitoring evaluation, research and learning expert, currently with the Mercy USA East African programs. Previously, I was with the University of Nairobi, social statistics, and also Deakin University. I would like to take this opportunity to give you a general recap on a paper I've worked on, outlining the benefits of Somalia trained, Canadian trained Somalia immigrants in rebuilding the water nation. I've been privileged to work as a monitoring and evaluation research specialist in Somalia over the last decade. And that has given me a privy knowledge on this topic. So the first, I would like to generally just give a background. And Somalia has experienced quite some protracted conflict and interclan wars. This began in the year 1991, when there was an uprising which led to collapse of the state. And then after a decade, the United Nations came up with a program of stabilization, and where a transitional federal government was set up. This happened in Kenyan capital, Nairobi. Government, there has been instability and social fragmentation. And this has led to mass migration. And this is where now the aspect of migration to Canada comes in, where Canada welcomed quite a number of Somalia immigrants under the Refugee Class Act. Then, based on statistics, by 2023, there were an estimated 62,000 Somali Canadians, predominantly living in the cities of Toronto and Edmonton. And then I would like to mention in the background that the Somalia diaspora has been critical in the nation's recovery, because as we speak, Somalia is still in a state of recovery. And because they have generally benefited from high quality education and exposure to democratic governance, something which cannot happen in Somalia at the moment. And generally, the global patterns in migration are changing, and the world over we hear about protectionism. But despite this, the Somalia educated immigrants have generally maintained connection with Somalia. And generally, in this paper, I'm examining the benefits that are attributed to them in a number of fields: general education, healthcare, business development, and social cohesion. I will continue a little bit with that overview and mention that most of these individuals have become doctors, teachers, business owners, political advocates, because they have gained their skills. And most of the skills, some of the skills, and if I don't want to use the word most, has been transferred to Somalia. And then a critical point which I would want us to keep in mind as we progress is that these Canadian trained Somalia immigrants have generally maintained dual identities, because they leverage between Somali culture and the Canadian democratic principles. And I would like to emphasize that this dual perspective has given them the opportunity to act as a bridge between the two nations. I've mentioned that earlier in the first slide that due to the civil war in 1990, the immigration peaked then. So it was at a high peak in the 1990s, and Canada became a preferred destination due to the opportunities in education and general professional development. And generally, when I mention Somalia in this context, I mean Somaliland and also South Central, where we have the other autonomous states, also Puntland, because anyone who understands the context of Somalia know that the Somaliland is a little bit a breakaway region and is self-governing, but this is not recognized internationally. Then let me quickly run through the methodology we used in this study. Where I employed a hybrid thematic analysis approach to explore this scenario. And participants, I had to consider those who have benefited and are currently living in Canada, and those who have benefited and come back to Somalia to contribute in the nation building. And the research period where I was looking at between the year 2020 and 2024. Then through convenience sampling, managed to have 25 participants, 10 residing in Canada and 15 in Somalia. But to corroborate this data, I had to look also at the key informant interviews. These are key individuals who are in sectors like NGOs, government, those who interact with these professionals to corroborate the information. Then interviews are conducted between January and February, and using standard template for the key informants. Then out of this sample, 30 managed to respond, and this was quite a good response rate, which is generally 86%. Statistically, that is impressive. And there was also rigorous desk research to basically gather information, because anyone like me who have engaged in Somalia for over the decade will realize that there has even been no official census. We use estimates from UNFPA, and generally there are a lot of scholarly articles on the protracted conflict and also on immigration from Somalia. So generally that provides a rich base for desktop research. There was the aspect of limitations on this study where some individuals whom intended to interview could not be reached, but this was supplemented by using the mobile telephony, so that we could call and then get feedback. Let me go through some of the key results. As I mentioned, that Somali immigrants educated and trained in Canada's educational system are contributing to the development and stabilization of the Federal Republic. And the key areas, apart from the general education, we have their strong contribution in terms of education in school and university development. Like we interacted with individuals who are now teaching at the University of Benadir, just to mention. And then aspect of contributing in curriculum development in institutions in Somalia in general, and also in teacher training programs. Then there is also the second key thematic area of their contribution, that is in contributing to democratic governance and democratic institutions. These individuals have been exposed to a more democratic society. So their contribution has been there in promoting democratic values and also generally in anti-corruption. Then there has been the third thematic area of healthcare, where there has been strong contribution in medical training and capacity building and addressing healthcare challenges. And then there is also, they have generally contributed greatly in telemedicine and remote care, because if you understand the Somalia context, you realize that there are areas where we still have non-state actors. Then the fourth key thematic area has been on business development and economic revitalization. On this thematic area, there has been the key important aspect of their remittances back home. Most of these individuals, as I mentioned, maintain dual identity. So there has been the remittances back home, which has been instrumental in providing livelihoods to women and children, and generally the unable in society as a source of livelihoods. They have also invested in infrastructure and general entrepreneurship. Then the fifth thematic area is in social cohesion and peace building and conflict resolution, where they have been able to come back home, capture lessons learned, stories, and this has helped in gender equality and women's empowerment. And the sixth thematic area I looked at was the youth engagement and programs. There are programs at the moment which were led by Somali-born in diaspora in Canada. So then the seventh aspect I looked at, which comes as a result, is cultural enrichment. And they are really promoting multiculturalism. And this has been experienced in Somalia as a society as we speak now, attributing it to the exposure they have gained in Canada. Then I picked some key case studies. Like in healthcare, we have a Canadian trained Somali doctor who has established a maternal care hospital in Mogadishu. This is reducing maternal mortality rates, and we have an estimate there of 30% within 2 years. Then the hospital also serves as a training center for local nurses. Another case study which the study picked was on education case study, where we have a Somali educator who completed her master's degree in Canada, founded a vocational training center in Somaliland, and has graduated over 500 students in fields of engineering and business management. Then business case study, we had an aspect of a Somali-Canadian entrepreneur who launched a mobile payment platform and now serves over 1 million. Let me quickly go to the aspect of challenges, because in a fragile environment, we have to look at some of the challenges and policy recommendations the study comes up with. The one aspect is insecurity, where we still have to acknowledge that
Sharif, name those challenges without explanation. Challenge
exactly.
1, 2, 3, then the
conclusion. The first challenge is insecurity. The second one is lack of strong collaborative partnerships. The third challenge is lack of clear pathways of promoting knowledge transfer, absence of inclusive employment practices. And the last one we noted was lack of strong settlement services while in Canada. Then in conclusion, generally, I note that Canadian trained Somali immigrants still play a transformative role in peace building of the Western nation, and their contribution spans governance, healthcare, education, development. And they are fostering sustainable development, peace, and progress in Somalia. And I think that what comes also as a conclusion is policies and partnerships should be strengthened to create an environment that supports their efforts and amplifies their impact. And as Canada continues to embrace diversity and multiculturalism, it's essential to implement policies that also maximize immigration benefits while addressing the challenges. And I think that I can end it at that. A lot of it could be in the main paper. Thank you.
Thank you, Khalid, for your presentation, where I demonstrated that Canada has contributed a lot for the immigrants from Somalia who studied in Canada, and they're doing something in Somalia. So some questions will come with the little minutes we'll be having. Let us go to the fourth person who's going to present, Petronila Mutinda King. She's based in Nairobi, from University of Nairobi in Kenya. The topic is enhancing collaborative research for Canada-Africa academic staff. King, the platform is yours.
Thank you so much. Can you please stop presenting?
Khalid, can you stop presenting, please? Or somebody presented the Khalid shared his work, or?
Okay, thank you so much. Thank you. I hope you can hear me.
Yeah, we can hear you, but okay, great.
Okay, yes, my name is Dr. Kingi. I'm from University of Nairobi. And I'm presenting enhancing collaborative research for Canada Africa academic staff. So that is our vision from University of Nairobi. And in 2021, the University of Nairobi and Western University formalized a collaboration agreement building on informal partnership between various faculties, University of Nairobi and Schulich School of Medicine and Dentistry. UON, a leading research intensive institution, is ranked as the top university in Kenya and among other top 10 in Africa. Known and, sorry, I want to make it. Yeah, so University of Nairobi, leading research intensive institution, is ranked as the top university in Kenya and among the top 10 in Africa. It's known for its impactful research and academic excellence. Now, the partnership aims at enhancing research, teaching, mentorship, and knowledge through joint initiatives, scientific exchange, and collaborative projects, further strengthening the University of Nairobi's goal, repetition, and contributing to academic, cultural, and scientific advancement. Now, the implementation methodology involved joint planning, design, execution, and monitoring to ensure alignment with the collaborative agreement and the partners' needs. Digital platforms facilitated the communication and resource sharing, while occasionally physical meetings strengthened the partnerships and fostered closer institutional connections. The benefits of this particular collaboration between the two universities has come up with numerous benefits, including joint publications, postgraduate student supervision, and knowledge exchange through webinars, practical experiences through intern placement, international research conferences, joint grant applications, collaborative online courses, and joint degree programs. So we have had a number of students coming from Canada to Kenya, about 50 students who have come for their experience observation at various hospitals, starting with the Kenyatta National Hospital, which is a referral hospital. It's the biggest hospital in the Eastern Africa. They also visited St. Mary's Hospitals, Machakos Hospital, and then dental school. So, the Kenyatta National Hospital and the dental school are our teaching hospitals at the University of Nairobi. And I should say that the university has got 7 campuses, 7 faculties, including the Faculty of Health Sciences, Faculty of Education, and basically the students who came to Kenya, they were under the Faculty of Health Sciences. That's why they were able to visit different hospitals, and they had very rich experiences. The students had also opportunities to travel to different places of interest like the Rift Valley. They also went to Mombasa, the coast of Eastern Africa, and they also went to different parks like Masai Mara. So in the course of their observations, the students were able to write numerous case studies, which I believe that they are now ready for publishing. So there is also the introduction of a compulsory module course for the students who are coming to Africa that we were able to write together. And right now we are in the process of revising and adding another module which is related to biomedical innovations. We've also been able to do roundtable meetings. We've been able to do together collaboratively PhD colloquiums. Students mobility, 2 of our students from Kenya were sent to Canada for 6 months experience. That is mentorship for early career researchers while ensuring long-term academic and cultural cooperation. So joint proposals were developed contributing to efforts in addressing significant global challenges in Kenya. Thank you so much.
Thank you, King. I think the 4 presenters have presented. I think you can stop sharing. Let us come to questions, but before we come to the questions, let me ask myself some questions, then we'll back to you. This question will be across to everyone who is here, who presented. Question number 1, to everyone, I'll be calling the name. What was the problem did you want to solve in your paper? What is the solution did you bring to that problem? I repeat, the paper you are presenting, what was the problem you wanted to solve? 2, how do you find the solution to the problem? I will start by King.
Thank you so much. Well, we had many other activities that we had done to solve problems. And
what
I'm
was
sure
the problem in your topic you are presenting to us? What did you want to solve? What was the problem?
Thank you so much. This particular one is just highlighting the main achievements, but there's someone who will be able to present some of the activities and innovations which were done at different vacancies. So I'm not really in those particular vacancies. So Dr. Regina Mutave will be presenting, and another key person from the vacancy at Chiromo. So this is just a highlight of the activities that we were doing. Basically, we were accommodating students who are coming from Canada to Kenya for their experiences. Thank you so much.
Thank you. Barak, okay? The same question?
Yes, please.
Thank you, sir. Generally, what I would also frame it in the sense that I was looking at the benefits attributed to the Somali trained immigrants in rebuilding the nation. Then the key area I wanted to come out clearly was what these are the benefits attributed to them at the moment. But then there are challenges. And you could see that I'm trying to bring out the challenges and policy recommendations. Like when you look at the state of Somalia, Canada at the moment does not have a full-fledged embassy in Mogadishu, or the consular services are managed from the embassy in Gigiri, Nairobi. So my point was to look at the benefits, then look at, from these benefits, I could see the gap, to identify the gap, the policy, the challenges, which I'm looking at as the gaps, and then have policy recommendations. That was my angle of looking at it.
Okay, thank you. And the third part, Shifa.
Yes, hello again. So
Yes,
our paper basically talked about cross-continental experiential learning and how we strengthened academic ties between Canadian universities and the Africa University. It was more of a demonstration of how the ACU Global Mobility Programs have helped bridge between the two spaces and encourage and provided experiences which have left the students with a lot of exposure and a lot of evolution of thought and experience of a different culture altogether. Some of the conclusions that we came up with towards the end of the paper were about possible tools and pathways to take to further strengthen these programs, which involves things like finding a sustainable and funding source and a resource mobilization to make sure that the scalability of these programs is something that is not a concern, because that is primarily a concern every cohort or every year. That is something we want to build and develop. Another thing was to explore various tools and technologies in this ever fast moving climate, with AI and virtual internships becoming more and more the easier or the better or more preferred route because of ease of access, and because it provides more accessibility to students who otherwise may not be able to travel and go, and due to funding concerns or immigration or visa arrangements. That is another concern that we thought could be something that to address. And finally, leveraging the alumni networks of such programs from AKU and other universities to really engage the students and to encourage them to speak about the experiences, because that, I think, makes more of an impact than any advertising or marketing would.
Okay, thank you. Omolo?
Yeah, okay, so for my own, we actually identified a major gap in literature, which was the implementation of global classroom, particularly among undergraduate students. So we wanted to close that gap and to be able to share our experiences. So that's why we actually designed the global classroom and implemented it majorly for the upper year undergraduate students. So we, at the end of this thing, we actually provided 6 key lessons that could actually like tools to actually help policy makers and educators to implement global classroom among undergraduate students.
Okay, thank you. So I think I can't read the question. Some people are asking questions on the chat. I can't see them. But we can call people for questions. We have only 5 minutes. If I have few people who can ask questions, please.
Yeah, we don't have questions in the chat right now.
Okay, great. So anyone with a question, please? I think, Philly Ado. Is it true?
Yes, Phyllis here.
Phyllis
Hello,
Ado,
everyone.
yes.
Yes. My question goes to Omolola. I hope I got the name right. Thanks so much thanks to all the presenters for those inspiring presentations. I would want to ask Omolola if the feedback from the students in the Global South, specifically Nigeria, included challenges with power and internet challenge, because it's a huge challenge here for us when we try to organize online programs. So I was wondering if you had such challenges and how were you able to handle those issues to get your program to be effective? Thank you.
Okay, thank you for the question. Yeah, the major challenges we had here, it was actually the internet connectivity and the data issue. So even from the feedback, the student actually complained about that. Though initially, at the end of the global classroom, what we did was we actually reimbursed students for their data. But doing that, we found out that that was actually not the best strategy, that we should have actually done that before we begin the global classroom, so that they will have like enough resources for data collection, and not after the global classroom. So that's a major lesson we actually took from our global classroom. So we had some challenges which we actually tried to provide solutions to. So those were part of our key lessons. I hope I answered that.
Okay, thank you. Somebody else?
Ndayizeye, I think your session's time is up.
Yes, that's why I'm winding up. So thank you very much, Melanie, for this opportunity. Hopefully the papers will come out very well after they improve according to the questions asked, and also people get time to improve them. Thank you. Thank you, Melanie.
Dr. Howard?
Yes, hello, Melanie. Hello, everyone. Glad to be here with you. Shall I go ahead, Melanie, with the session? You can see on the program there is health break, or shall I move ahead?
Just go ahead with your session.
Great, thank you so much. So, hello everyone, my name is Bassem Awad. I am a professor at the law school here at Western University and the director of the area of concentration in intellectual property and information technology. I have the pleasure to share the policy session today. I have 4 excellent speakers from different countries that will be covering topics related to the policy schemes that we have. I will ask the four speakers to limit their presentation to 8 minutes, and we'll have 2 minutes of Q&A after each speaker that we have. I will start with the introducing first speaker.
Can I say something, just something small about my presentation? Maybe I could mention that when we were writing the module, we were trying to solve some of the cross cultural barriers, like the LGBT, the cultures in Africa, because the cultures are quite different from Kenya and Canada. So when we wrote that book, we were trying to demystify so that when the students come to Kenya, they understand. Of course, there were some challenges here because the cultures are quite different. And when the students go to the hospitals, you'll find that people may not understand. And also the students may not understand some of the practices. So in writing the module, we were kind of solving a kind of a cultural barrier. Thank you so much.
Thank you, Petronella, for that. So I will start with the first speaker that I have in my panel, and I have the pleasure to introduce Iobi Izatu from the Organization for Innovation and Sustainable Development Africa, I believe based in Ethiopia. And the topic will be the policy imperative for accelerating entrepreneurship and innovation landscapes in African universities. Iobi, the floor is yours. Do we have you online? You?
I suggest we move to the next person so that if AOP shows.
Okay, so I will move directly to the second speaker that we have, Dion Sinclair from Western University. If you are ready, we can go ahead with your topics on the nurses as policy shaper expanding roles in health governance. Dion, are you around?
Actually, so this is Michelle Ray and Francesca Okafor who will be doing the presentation today.
Thank you, Michelle. Go ahead, please.
Thank you.
So
Sorry,
we have Michelle Ray. Go ahead, Michelle.
Sorry, I'll just share my screen. Sorry, can you see my screen?
No.
Okay, I'm just going to try that again. Apologies.
Yes, we can see now.
You can see. Okay.
Yeah.
Excellent. So first, my name is Michelle Ray. I'm the Director for the International Affairs and Best Practice Guidelines Center, and I'll be joined by our partner from Nigeria, Dame Francesca Okafor from the Federal Ministry of Health. So we'll be giving a short presentation about nurses as policy shapers, expanding the roles in health governance. So first, a little bit about the International Affairs and Best Practice Guidelines Center. So that is a program that has been led by the Registered Nurses Association of Ontario as a global leader in developing evidence-based practices for nursing and healthcare. It was launched in 1999 by our program founder and visionary, Dr. Doris Grinspan, and it's funded by the Ministry of Health in Ontario. So RNAO develops best practice guidelines that offer comprehensive and evidence-driven recommendations for improving patient care, organizational outcomes, and healthcare systems. But we don't just stop there in developing guidelines that sit on the shelf. We actually partner with a number of different organizations across the world. So we partner with a program called the Best Practice Spotlight Organization. And we have over 1,500 partners across the world in Canada, Spain, Chile, China and Mexico, and now in Nigeria, the first African country BPSO host, partnering with RNAO to implement evidence-based care. The RNAO BPG program encompasses 3 core pillars. So best practice guideline development, which I've spoken about, where we also disseminate and then support implementation through our BPSO program. We also support monitoring and evaluation, and this is really critical in being able to measure the program's impact using tools like our nursing quality indicators for reporting and evaluation system, which helps our BPSOs track improvements in clinical outcomes and patient outcomes and staff outcomes, and anything related to care delivery and provider experience. So I'll talk a little bit more about the BPSO program and our partnership with Nigeria before I turn it over to Francesca. So the BPSO program is a designation. It's a key component of the IABPG Center, and it recognizes institutions that formally partner with RNAO to implement BPGs and demonstrate their impact. The BPSO program focuses on creating long-term partnerships that enhance patient care through evidence-based practice, establishing effective evaluation methods, like I mentioned, of our Enquire system, and promoting system-wide dissemination of our best practice guidelines. BPSOs commit to a 3 to 4 year qualifying period where they implement BPGs, evaluate outcomes, and upon meeting all of the deliverables, can then achieve a designated BPSO status. And this status is renewable every 2 years. So the BPSO designation supports both individual and organizational capacity building, fostering evidence-based cultures within health services and academic organizations. And then experienced organizations like our new partner in Nigeria can serve as BPSO hosts, and hosts liaise between RNAO and BPSOs on the ground in their own country, in a specific country or region. So now I'll turn it over to Francesca to tell us a little bit about the Federal Ministry of Health and the partners that we are just established there in January. Over to you, Francesca.
Thank you, Dr. Michelle. Good afternoon, everyone from Sunshine of Africa. My name is Dame Francisca Okafor. I'm the Director of Nursing in the Federal Ministry of Health. The collaboration with RNAO and the Federal Ministry of Health started based on Nigeria's broader efforts to strengthen the healthcare system through evidence-based nursing practice. The partnership was inspired by the success of the RNAO BPSO program around Canada and other parts of the countries. And as Dr. Michelle had said, Nigeria now is the first country in Africa to have joined this bandwagon. Recognizing the need to enhance nursing standards and align best practices with evidence-based practice, Nigerian government, through the Nursing Division, Federal Ministry of Health and Social Welfare, engaged the RNAO for implementation of best practice spotlight organization model. We felt we needed this, particularly in the face of huge nursing workforce shortage that was necessitated by the migration, health workforce migration we had suffered starting from post-COVID. So as we know, Nigeria is a very big country with a population of about 230 million people, Nigeria is made up of 37 states, including the nation's capital. Health services in Nigeria, it's on 3 levels: the primary, the secondary, and the tertiary. The tertiary is owned directly by Federal Ministry of Health and Social Welfare, but the seat of the government chief nursing officer, which is my office, equally collaborates to oversee what is done at the secondary and the primary levels. So we have about 80 federal tertiary health institutions cut across these 37 states that is directly owned by the Federal Ministry of Health. And we needed to pilot BPGs of RNAO. So we had to ensure that full representation of the different zones. So we had selected 2 facilities each from the 6 geopolitical zones in Nigeria to pilot. So altogether we had 15 centers that we have piloted this training in. You would know that the RNAO is for evidence-based practice, and they had published over 54 BPGs, but we are starting with 4 for the period of this collaboration that is renewable, as Dr. Michel had stated. So we had a signing of MOU between RNAO and the leadership of Federal Ministry of Health. And this is in order to get the buy-in of the highest management for its sustainability. So on the 20th of January, we had a virtual launch, and it was quite insightful for both parties because RNAO was doing virtual launch and virtual ceremonial signing of a MOU and virtual training for us. And for us, it's like thinking outside the box, because if you look at the cost implication to have brought them in, and Nigeria, our PPSO direct, that's the facilities that we were piloting in, we had them equally joining online. So we succeeded in saving quite a huge cost. And we thank God for internet friendliness. We were able to navigate around, and we had a very successful launch that was chaired by the Permanent Secretary, Federal Ministry of Health. We had the chief executives of our federal tertiary health institutions where we are piloting joining. We had directors from Federal Ministry of Health and Social Welfare joining. We had, of course, RNAO and Nigerian nurses in Canada represented. We had somebody, adding her voice to giving goodwill message. We had nursing stakeholders from our regulatory body in Nigeria, as well as the association. So the main training was based on the 4 BPGs that we selected: transition in care best practice guidelines. We had implementation process. We had a change management strategy for integrating best practice guidelines. And we had also monitoring and evaluation framework to assess the impact of evidence-based care. So the benefits and impact of BPG is to improve patients' outcome. Because if you look at what Nigeria had suffered, having lost almost the best hands, to migration, and the fact of the economic downturn that we are currently facing, we needed to see how do we kind of improve our care to make sure that our patients are receiving evidence-based care. And BPG is also to empower the nurses. Nurses now are equipped with up-to-date knowledge and tools to provide world-class healthcare services. It also talks on leadership development, and nurses are trained under the program, for policy implementation in taking clinical decisions. It also strengthens the healthcare institutions of these 15 pilot institutions. And it's kind of gives us international recognition, being the first in Africa to adopt best practice spotlights organization framework, and positioning us as leaders and innovators on the continent. Looking at our next steps, we are thinking of expanding the BPSO centers. Like we had said, we piloted in 15, and we have over 80 institutions. So we are hoping to get more partnership, and then getting our government to commit more funding for the sustainability of these projects. So we also hope to continue training and mentorship, regular capacity building. We hope to integrate policy, also to see how we can imbue the BPSO into the curriculum of the nursing colleges and the universities in Nigeria. Thank you, and over to you, Dr. Misha.
Thank you, Francesca, for giving an overview of the wonderful launch ceremony and the training that we had for over those 4 days. And I'll just briefly, just given time, talk a little bit about some of that training that Francesca mentioned. RNA's approach to knowledge transfer really incorporates different innovative methodologies, including grassroots activism and a little bit of political action where necessary. We're really focused on building collaboration and coalitions and using social media where helpful to inspire widespread adoption of BPGs. And it's really become an international social movement of evidence-based practice. So the BPSOs, they use the program resources that as part of the training that Francesca spoke about, and that includes the Leading Change Toolkit, which is comprised of the Social Movement Action Framework, which is the blue wave there, and the Knowledge to Action Framework, which is the circle, which has evidence in the middle and then talks about the different components of being able to take knowledge and then implement that into action. So that once you've developed that guideline of the best practice recommendations, how do we then turn that around into implementation? Really integrating evidence-based care into those clinical routines. The program emphasizes that social movement approach, and really the key there is to spread the knowledge, engaging the healthcare professionals, the leaders, and the communities at every level. And that includes both the front line, the leadership, the health system, and policy. So this is why we're so excited to be able to partner, as we've done with other countries, with the government to be able to think about how we can create policies that are going to be implemented across the country. The program also has some specific initiatives for vulnerable populations, such as Indigenous health and mental health care. And we really want to ensure that equity is central to the mission and the movement of social evidence-based practice across the world. So with BPSO, we do it together. This is a very collaborative and evidence-based framework that RNAO's program has built. And it's, again, to foster that transformation in nursing practice. And it's not just nursing practice, it's really transforming knowledge in healthcare overall, enhancing healthcare quality globally, while empowering nurses to lead positive change in their communities. And so we're so excited to partner with Dame Francesca Okafor and her team at the Federal Ministry of Health and the 15 hospitals across Nigeria, as they have just joined the over 100,000 change agents in the Best Practice Champions Network from Ontario and around the world. And I would be remiss to not mention our founder of the program, Dr. Doris Grinspan, who sends her regrets today. It's actually a political election today in the province of Ontario, and so she is working diligently at Queen's Park today. But I know that she would want to send her thanks for the opportunity to share a little bit about our partnership and the collaboration that we're doing with nursing and policy in Nigeria. And also note that we're welcoming any new partnerships across the continent in delivering evidence-based care.
Thank you, Michelle and Francesca. Really appreciated this excellent and inspiring work. I will have to move to the next speaker, and we can collect the question towards the end if any question we will have. So my next speaker is Sola Walabi from Bells University of Technology in Ogun State in Nigeria. And the topic that Sola will be covering is the CAACC, an innovative bibliography game for combating verbal bullying. Sola, are you online?
Maybe we can skip Sola if she's not responding. If you have any other person.
Okay, so the next speaker that I have is Pauline Omolo from the University of Nairobi in Kenya. Pauline, are you online?
Yes, I'm online.
Great, perfect. So Pauline will be covering the topic of the footprint evaluation, a framework towards an integrated approach to monitoring and evaluation practice. Please go ahead, Pauline.
Yeah, thank you very much. Let me just put up the presentation.
Meanwhile, are we able to get Job? Was that you?
No, so I have to skip to the next one.
Perfect. So,
Hope that you can see my presentation.
yes, clear. Go ahead, please.
Thank you very much. My name is Pauline Omolo from the University of Nairobi, and this paper we did in collaboration with Dr. Melanie Katsivo from Western University, Professor Chalo from the University of Nairobi, and also Professor Angeline from the University of Nairobi. Now, when you talk about footprint evaluation, one of the world's interconnected environmental crises, such as climate change, biodiversity, and declining air, water, and soil quality, emphasis mostly is on the need for sustainable practices in all the sectors. And one of the issues that came up from COP19, that is from the Paris Agreement on the national determined contributions, one of the issues was on footprint evaluation and integrating it in the process of evaluation in order to look at the processes and the impacts. And we realized that in evaluations, unless it is explicitly stated in the project objectives, footprint evaluations is never captured. And yet we know that most of the activities that we do, they affect the environment either directly or indirectly. So this study identified gaps in current monitoring and evaluation practices, and based on a study that was conducted across projects in Africa, that is projects that are economic-based, programs-based food security. It was identified that most of the programs still use traditional cost effectiveness matrices, whereby they look at only the economic outcomes over environmental or even the social impacts. So this study identified that there is lack of monitoring and evaluation framework that looks at the comprehensive indicators, and we realize that there's a lot of interplay when it comes to human and natural systems, even according to UN 2023. And also in the existing literature, there are also gaps on environmental impacts that addressed on non-environmental projects, and some such studies by Bamberger and even Segon highlighted that monitoring and evaluation practices in developing countries often lack the capacity for frameworks to include the environmental considerations. Based on this, we realized that teams with expertise in systematic evaluation and also natural systems, there's a gap in terms of not addressing these aspects, and that is how the footprint evaluation is going to fill in this void, because it promotes the inclusion of environmental impacts, regardless of whether they are explicit project objectives or not. And footprint evaluation is a framework, and it addresses concerns that includes environmental impact and also assessments, both looking at the actual and also the potential impacts. Now, we identified projects across the evaluation of focus, and we identified around 10 projects on reforestation initiative. And this type is on explicit environmental goals.
So based on this, when you looked at the goals for these projects, they looked at the forest cover that enhances biodiversity, reduce carbon emission. We looked at the approach, the evaluation approach, because it captured the environmental indicators. We also had projects around renewable energy, which are explicit environmental goals. And when you talk about explicit environmental goals, they are projects that are purely, the objectives are direct and they're based on environmental goals. But we also identified other projects such as urban and housing programs, educational outreach programs, which some of them had were not in an environment goals directly. And when you looked at the evaluation reports, most of them were looking at the cost benefit in terms of unit of analysis, beneficiary satisfaction. They were looking at measured outcomes in terms of enrollments, test scores, but they do not integrate the element of footprint evaluation. So when we conducted a comparative analysis on this project, for the ones with explicit environmental goals, meaning that they had direct goals or other objectives that were geared on environmental aspects. For instance, when you looked at the primary indicators, we identified that most of them covered the carbon emissions, the renewable energy, and the contribution of those projects, the projects to the environment. And when you looked at the projects without environmental goals directly, they purely looked at the enrollment rates, for instance, looked at houses built without bringing in the element, embedding the element of footprint evaluation in terms of the impact of those projects on the environment. And also another aspect that we looked at was on environmental considerations, whereby for the projects that were explicitly had explicit environmental goals, we realized that central to evaluation, like using the key performance indicators, they tied them to the ecological sustainability. However, for the ones that did not have explicit environmental goals, they ignored some of those indicators in terms of, for instance, look at energy efficiency in housing, but not necessarily bringing out how the interactions affect the environment and in turn how it's impacting to the human environment. We also looked at the scope of evaluation, whereby we looked at the element of the explicit programs having the broad element, including economic, the social, and environmental impacts embedded in the scope of evaluation. However, for the ones that were not having the explicit goals, they were a bit narrow and they were focusing on economic impacts, social outcomes only, without bringing out the impact, the environmental impact and the contribution of those programs in terms of contributing to the footprint element. And you also looked at the interdisciplinary teams, where you find that for programs that are explicit to environmental goals, they include environmental scientists, economists, social experts, and at times these social experts are also trained on the environmental aspect. But when we looked at some of the programs that were not explicit, did not have explicit environmental goals, we identified that most of them composed of experts, for instance, like education, housing, and so on, but they did not bring out that element in terms of the training and also how to measure footprint element in the evaluation. We also looked at the alignment to the SDGs and realized that the ones that were directly had explicit environmental goals were aligned to SDGs, for instance, SDG number 13, climate action, but the ones that had not explicit goals did not align unless they were specified directly. And even when you look at, for instance, the TOR, most of the teams had to bring out those elements for them to be able to bring them out clearly in the reports. Now, based on that comparative analysis, we concluded that when you have collaborations between Canada and Africa, it can serve as a model for achieving monitoring and evaluation practices through the footprint evaluation. And when we combine the Canadian techniques, the innovations, and also the African contextual knowledge resources, and also this partnership can create robust, inclusive, and sustainable evaluation frameworks. And we also find that such collaborations will not only advance the goals of footprint evaluation, but it will also strengthen the global push towards achieving sustainable development goals. And also some of the recommendations we brought out was about policy integration in terms of advocacy changes, and also the mandate for inclusion in the environmental impacts. Also on the element of capacity building, whereby we come up with interdisciplinary training programs for evaluators, where we are focusing on environmental sustainability and also the natural systems. And also another element is on enhanced indicators, where we create and standardize monitoring and evaluation indicators that reflect the interplay between the human and the natural systems, and also in collaborative teams, where we encourage the inclusion of experts in environmental sciences within the evaluation teams, and also just for future research, whereby we conduct also developing, or rather addressing the evidence-based intervention designs on long-term impacts for integrating footprint evaluations framework into diverse intervention. Thank you, and over to you, Dr. Bessie.
Thank you, Pauline, for that. I have to thank the speakers for today. So we have heard from Francesca and Michelle about the nurses as policy shapers, and we have heard from Pauline on the framework for the environmental sustainability. Thank you so much for your interventions. I was informed that we have to move to the next session, so I will have, unfortunately, to skip the Q&A session, and I want to thank you so much for your valuable insights, and we'll move to the next session on the climate and environment. Thank you so much.
Professor Gaye.
Hello, good morning, good afternoon, depending on where you are now. So thank you very much. I need to thank also the chairs and presenters of the last session, and also thank the organizers for this very interesting conference. So it's my time now to share this session on climate and environment. So at this time, I want to give the floor to Cristonio Onyo. I want to just remind all our presenters, I think there are two in this session, that they need to really do the presentation on maximum 8 minutes, so that we can have maybe 3 minutes or 5 minutes at the end to answer to the question from the assistant. So, Cristonio, you have the floor.
Thank you so much. My name is Cristonio Honya, and I want to present the first presenter, which is Faye Dumaker. His presentation is going to be on forecasting air quality using machine learning, a case study of PM 2.5 concentration in Rwanda. So Faye, please, if you are around, we are listening.
Hello.
Hello, Faye.
Okay, you understand me?
Yeah, I get you. Thank you.
Thank you. Hello, everyone. My name is Juma Korfai. Today I will present to you a study in air quality in Rwanda, conducting in collaboration between the University of Dakar and Western University Canada, and the supervisor of Pierre Elzil Kaliza, Western University, and Professor Amadou Tianougay, University of Dakar. This research title, Understanding Air Quality, Insights and Innovation, combining climatology and artificial intelligence to address on urgent challenge protecting public health against in air pollution in Africa. Okay. So introduction to air quality and its importance. The fundamental role of air quality. The air quality is essential for monitoring ecosystem balance and supporting life, and he is directly impact public health with significant risk associating with poor in air quality. This figure at the top right, heading the impact of air pollution in heat. It indicates that air pollution is responsible for 30% of die from the low respiratory infection, 28% of die due to insectemic heat disease, and 38% die relating to chronic obstructive pulmonary disease. Building on this alarming statistic,
Giamaka, please check your mic.
What is good?
You're fading away.
It's good. Hello?
Can you please come closer?
Hello, it's good. Do you hear me?
Yes, it's better now.
It's better, but you are far. You are speaking very far from your mic, I think, or you need to withdraw it.
Yeah, I say building on this alarming heat statistic, it is become clear that continuous air quality monitoring and effective management strategies are essential to mitigate environmental and public heat risk. The context of air pollution in Africa is Africa is a region most affected by air pollution globally. We find particularly matter level frequently exceeding WHO recommendation threshold. Also on the map to the right, which displayed the annual mean ambient PM 2.5 from measurement. Heat PM 2.5 concentration are primarily observing in Africa, with some area showing level nearly 100 microgram per cubic meter. In Sub-Saharan Africa, air pollution contributes to over 700,000 premature deaths annually, driven by its impact on respiratory and cardiovascular disease. Despite the several heat risks, quality monitoring data remaining largely inaccessible to the public, heatly affecting politic response and public awareness. Significant link of air quality studying. Understanding air quality in this region is crucial for public health, particularly for vulnerable population. The education air studies air to identify area needing targeted intervention to improve the air pollution. In this case, the research context on objective. This research is for a collaborating partnership between the University of Dakar and University of Western Canada. The focus enhancing research capability in climate science and meteorological. The research focus is application of machine learning technique for air quality forecasting, targeting the PM 2.5 concentration across various provinces in Rwanda. The public health implication is addressing the significant heat risk associated with the air pollution, meant to reduce the estimated of 3,000 deaths attributing to ambient air pollution in Rwanda. The methodological approach is to identify the atmosphere variable that influence fine particle matter concentration. For this, we use machine learning model to learn the relationship between this variable and particle matter concentration in order to predict this level and access the corresponding air quality. Long-term goal, development of early warning system for air quality management and supporting target public policy to improve the air quality and public health in Rwanda. Here, for the result, we evaluation of model performance. Just calculate compare the predicted value with the measurement count. The closing the point are to the diagonal, the more accurate the prediction. The table on the right summarizes the average performance of the best model by province. In summarizing this slide, heading that the evaluation machine learning model can predict PM 2.5 levels with good reliability. The best performance generally come from the ensemble model, and the result may vary by region. Emphasizing the importance of adapting the calibration, the model basing on the local specific. And in the local specific, here we saw the air quality analyzed across province, the seasonality variability in PM 2.5 concentration, filling PM 2.5 level are observing during the dry season, particularly from June to September and January to February, due to the reduction, precipitation, and wind conditions that favor particle suspension. And for the geographic disparity, the western, southern Kigali and eastern province exhibit the heading PM 2.5 concentration, while the northeast province maintaining relatively good air quality, highlighting the need for targeting intervention in more politic area. The public health implication, the analysis for the significant heat risk associated with elevating PM 2.5 level necessitating the development of effective public policing and early warning system to protect vulnerable population and improve air quality management. And in the conclusion and future work, the application of machine learning technique has demonstrated the significant protection and accurately prediction PM 2.5 concentration across Rwanda's revealing complex relationship between environmental factor and air quality. For the future directly, if the future research so prioritizing the integration of real-time data and additional explanatory variable, which explaining the studies scope to
I think we need, Madam Rapporteur, I think we need to conclude with that one presentation.
The robustness of air quality forecasting model and address continuing with disparity in pollution exposure, enabling
Yes, we'll have to continue because of time.
Okay, thank you. The next presenter is LV, and LV is a QS scholar, and then she is presenting on prevalence of food insecurities and factors associated to low short-term memory development among primary schools. So, LV, if you're around, please. Thank you.
Jumoko, need to unshare your screen.
I hope we don't have Daniel. Whose screen is this?
I don't think it's Daniel. I think the person might have used Daniel, so would change the name.
Okay. Just wanted to be sure it's.
Hello, are you getting me well? Hello, are you getting me well?
Yeah, we can hear you. You just have background noise.
Okay, is it okay right now?
Yeah, it's better, but you need to make it in the presentation mode. Thank you.
Okay. Okay. Hello, my name is Elvia Sogba. I am from the University of Abomey-Calavi in Benin Republic. I've been a late QS scholar last year at Western universities. I want to present you today my work on the relationship between food insecurity and short-term memory in Benin Republic. This work was done under the supervision of Isaac Longina and Professor Waliu Amusa Hunkwati from the University of Abomey-Calavi and the University of Western. My presentation will follow this template. I will present you at the first time the objectives, the methodology. I will follow with the suggestions. Can I go on? Malnutrition is not a new phenomenon to describe in Africa. It stems from the inadequacy of the food supply to the body and the poor health facilities. Poverty stems in the lack of education, which brings to a low income for households, which lead to hunger and poor health, which is roots for poverty. The government in Africa identify school canteen as a solution to fight malnutrition and to increase enrollment in primary school. This study aims to investigate the relationship between food insecurity and short-term memory. The study area was essentially the peri-urban areas in the North Benin and in the South Benin. In the North Benin, we select the municipalities of Tukuntuna and Bukumbe around the urban area of Natitengu. And in the South, we selected Abomey-Calavi and Semekoji around the urban area of Cotonou. For the sampling, we use the Sharon and Biwas formula to select in total 524 pupils, 237 people in the south and 287 people in the north. For the human resources, the staff was represented by biomedical analysts, nutritionists, sociologists, and some other people like the administrative from the schools and the community members as stakeholders. The tools we use in our data collection was essentially sorry, for the cognition, the DigiSpan, which measure the short-term memory among the primary pupils, and the verbal fluency. To measure the food insecurity, we use the HFIA scale, which follow FAO guidelines. We also collected data on hemoglobin level with the HemoQ device, and we also collected some socio-demographic characteristics like age, gender, caregiver literacy, and household wealth and electricity. On nutritional status, we collected also data on body mass index and some data on health status. We use a digitalized question. As a result, we find that in the North, the food insecurity prevalence was higher than in the South. But in the South, a lot of people was affected by mild food insecurity. The bivariate analysis revealed that only the household wealth was associated to the short-term memory. But when we go with the multivariate analysis, we find that household wealth, electricity, caregiver literacy, age, and severe food insecurity are the key factors that are associated to the short-term memory. Our results for the food insecurity impact negatively short-term memory are consistent with Tete et al. In 2024. Also related to household poverty, which impact negatively short-term memory, our results were consistent with Casale, Desmond, and Teklu. Also, the age influence short-term memory, which is consistent with finding of Abraham et al. And Peter. On the other hand, we also find that the dietary diversity influence positively short-term memory. We find that among the boys, more boys show low verbal fluency than girls. Sorry, more girls show low verbal fluency than boys. This is showing some gender disparities among boys and girls in this area. As suggestion related to our work, intervention and policy aim at fighting food insecurity and poverty should be emphasized in Benin Republic, especially in peri-urban areas. Intervention to improve household access to electricity in remote areas, in peri-urban and rural areas should be emphasized in Benin Republic. Dietary diversity for primary school children should be promoted to achieve optimal cognitive development, which may lead to better academic performance. Also, for future research, we recommend that the relationship between feeding habit, cognitive abilities in urban areas be assessed. We also recommend that some research be held on feeding impact on cognitive abilities among children in urban areas. We also recommend that activities to enhance cognitive ability among children be addressed. Thank you for your kind attention. I also thank all the staff of the University of Abomey-Calavi and the University of Western. Thank you very much.
Okay.
Thank you so much.
You're muted if you're talking, Professor Amadou.
Okay, yes. Thank you. Yeah, thank you so much. I don't know if we have time for maybe one question, then we can move toward the session. Do you find some question in the Q&A?
Yes, we have one question.
Okay, go ahead.
Oh, not a question, but it's a comment. The person said, I have always wondered, how do we link the level of malnutrition to the size of any family? I think the prevention should start by the family planning issues.
Okay, could you answer or comment on that?
It's just a comment, yeah.
Yeah.
To the presenter.
Yeah. I think she presented good. You can comment on that or at least agree. Okay, but there's Jean Damascene.
Yeah. I definitely think that planning family.
Yes, I still the same
Wait.
who made the comment. I wanted to hear if there is any comment from the presenter or yourself, Professor.
Can you repeat?
I was saying that is me who made the comment.
Okay.
I would like to hear if there is any comment from the presenter or yourself, Professor.
Thank you.
Yeah,
So
thank you.
let us hear the presenter who did the work. I'm sure she's able to tell us what she thought.
Thank you for your comment. Definitely, I think you are right. And we should start by family planning issue because the larger the family is, the larger will be the needs to fulfill the family's needs and to give proper education for pupils and also to help them be in a good state and not be malnourished. So I think you are right. Yeah.
Thank you, and I appreciate.
Thank you so much. Okay, can we move forward?
We have one question. It says, not clear on the disparity measure between boys and girls, in bracket food insecurity. Also the long-term effect on girls' academic performance long-term.
Yeah, actually, we are still working on the data sets, and these are the primary results I just presented right here. And we also have academic, we also have like variable academic performance, which is grades of the pupils. So right now we are working on a model to explain academic performance per gender. So we are still working on it, and maybe in a future presentation, I may present that result too. Thank you very much.
Thank you so much. So I think we can move forward if you want with rapporteur.
Okay, thank you. Our third presenter is George. George is from the University of Nairobi, Kenya, sorry. So if George is around, please kindly go ahead.
George, you'll need to move faster.
Sorry for the delay.
George, you can make it on presentation mode, And I will want the next presentation presenter to be really ready to go just after the presentation. Yeah, so that we can be on time. Okay, go ahead, George.
Is that
Sorry.
all right?
Go ahead.
Okay, thank you. I'm presenting on socially responsible investing and the performance of climate smart agriculture projects. This is a study that have been done in the support of my supervisors, Professor Rambo, Dr. Wafula, and Dr. Mwenda. It's on agriculture and climate smart agriculture in Kenya, in one of the counties that is in semi-arid area. And in the same note, I focused on what is ailing most of the global perspective in terms of food security. And we note that agriculture contributes 19 to 29% of greenhouse gas emissions. And the more the greenhouse gases are produced, it means that there is global warming. Global warming in turn hinders food production. Therefore, it's a complex situation because agriculture is producing that which hinders food production. Therefore, there must be a solution to ensuring that food production does not hinder its efforts. So to do that, we have to keep on checking on which are these practices that are hindering food production, yet they're in food production. One is to reduce waste of food production. Globally, out of all the food produced globally, 30% goes to waste. In Africa, 30 to 50% goes to waste. Therefore, we need technology and innovation to improve on the efficacy in the utilization of the resources that we have. It has been noted that we have the inverted U-Kuznets curve explains the effect of economic development and environmental degradation. That means at a certain level of economic growth, the environmental degradation increases proportionally with economic growth. However, at a certain level of economic growth, now environmental degradation reduces as economic growth continues. Therefore, there is a need to promote economic growth in the nations to help in the reduction of environmental degradation. In the study, I focused on 2 out of the 17 World Bank sponsored climate smart agriculture projects in Kenya. That is Karioga and Davimi projects. And the research methodology that was applied was concurrent mixed method. The area I've indicated with a sample of 512 and stratified sampling to identify the 2 projects, simple ladom to identify the respondents, purposeful to identify key informants. And the quantitative data was corrected through questionnaires, qualitative data through interview guide and observation guide. And for ethical purposes, I got the letter from the university and the institution in Kenya that guides the research in Kenya. And for data analysis, I used measures of central tendency, measures of dispersion and correlation, and F-test. And those were the findings. I may not have to explain about those figures. And what I came up with as one of the chairpersons indicated, there is need to identify what's the problem and what was the solution, is that socially responsible investing is critical in promoting effectual resource allocation, help farmers to be proactive, that is in risk management, and reducing the challenges that are inhibitive to food production, increase risk management ability, and create incentive to invest in agricultural productivity technologies. That would help reduce the wastage and also help to promote efficacy in using the resources. The recommendations is the government to provide infrastructure that supports resource stewardship and policy to create implementation to protect resources. And there is need to think of possibilities of having public-private partnerships to replicate the CSA as in Laikipia in other areas, mostly in the areas that form the food baskets in Kenya, to ensure that Kenya approaches the food security level. Thank you.
Thank you so much. I think we'll keep the question for the end. So, Rapporteur, can you introduce the next one?
Okay, so the next person presenting is Juliana Toboye from UBIST. And yeah, so Juliana, we are listening.
Yeah, can you hear me? I see
Yes,
my
Juliana, we can hear you. Yeah, we are seeing your screen too.
All right. So my presentation is on trying to investigate the factors that influence farmers' decision to adopt climate-smart agricultural practices.
Can you put it in a presentation mode, please? Sorry.
Yeah, thanks. Is it okay? Yeah. So climate is widely recognized as a significant global threat with far-reaching implications for development. For instance, the IPCC confirms that global agricultural productivity is significantly impacted by climate change to the extent that food crops like rice, maize, and sorghum are having dwindling yields due to the impacts of climate change. Now, a significant adaptation measure to ensure that there is food security in the household level is the adoption of climate-smart agricultural practices introduced in 2009, which the Food and Agricultural Organization defines as agriculture that sustainably enhances productivity, improving resilience of our fields through adaptation measures, and reducing greenhouse emissions as indicated by the earlier presenter through mitigation measures. So it is envisaged that if climate-smart agricultural practices are adopted, it will go a long way to improving the achievement of SDG 2, which addresses zero hunger, talking about achieving food security, improved nutrition, and promoting sustainable agricultural practices. Also, SDG 13 that seeks to take urgent action against climate change and its impacts. Trying to look at sustainable measures that will have less impact on the environment. So this study investigates the factors that influence farmers' decision to either adopt climate-smart agricultural practices or not. You know, the practices are there, they are sometimes introduced to farmers, but as to whether they are adopting it or not, there could be some influencing factors why they will adopt or not adopt. So the study employed a quantitative research approach where 400 farmers, smallholder farmers, were interviewed in communities where climate-smart agriculture practices are being promoted. So we used stratified random sampling where these communities were put into strata, and out of these stratas, each of these strata, we then had random sampling for respondents to respond to our questionnaire. Descriptive statistics, bivariate and multivariate analysis were used to analyze the results from the study. The dependent variable for the study is the adoption of climate-smart agricultural practices. And then we also had demographic factors such as gender, age, the marital status of respondents, educational attainment of respondents were also considered for the study. Other variables were the benefits or motivational factors that farmers will look at or consider, which were influencing their decision to either adopt climate-smart agricultural practices or not to adopt climate-smart agricultural practices, and some of which were resilience of their farm against climate change, and then a reduction in the input cost of their fields were some of the variables that were considered in the study. Also, support systems such as access of farmers to extension officers, sufficient financial incentives like credits to farmers, and then government policies that are favorable also were motivational factors that were considered in the study to find out whether all these ones play a role in farmers' decision to adopt climate-smart agricultural practices or not. Logistic regression models were used to analyze data obtained from the field. On to the results. 92.75% responded yes to adoption of climate-smart agricultural practices, made up of 69.5% males and 30.5% females. With regards to demographic factors, the findings showed that the younger generation, that is ages 26 to 35 and 36 to 45 of respondents, were less likely to adopt climate-smart agricultural practices. This could be attributed to the fact that climate-smart agricultural practices are age-old practices that are repackaged, and so it is understandable that the elderly farmers would most likely adopt these practices as compared to the younger generation. Also, based on the findings, improved crop yields, farmers who had their fields improved by practicing climate-smart, where they are more likely to adopt these practices. Those who also had reduced cost of inputs that they will have to use on their fields, were more likely to adopt climate-smart agricultural practices. Access to extension services, training on climate-smart agricultural practices were also motivational factors from the study. It came out that they were also motivational factors that influence farmers' decision to adopt these practices or not. Moreover, the study also indicated a significant relationship between other demographic factors such as education, marital status of farmers. Marital status played a key role where we realized that married farmers with families, married farmers were more likely to adopt climate-smart agricultural practices. This is understandable because there is the need for them to maximize their productivity from sometimes a small piece of land and then be able to feed their families as expected. So in conclusion, looking at the fact that demographic factors played a role or was an influencing factor in farmers' decision to adopt climate-smart agricultural practices or not, the study recommends that existing institutions must be strengthened to roll out relevant policies that support these programs to facilitate the adoption of climate-smart agricultural practices. It is also recommended that relevant stakeholders should also take smallholder farmers' socio-demographic factors into consideration when promoting climate-smart agricultural practices. Thank you. So I would like to acknowledge my supervisors here at Western, Professor Isaac Lugner and Prof. Aku, and back home in Ghana, Professor Pepra and Prof. Ambeir for their input into this study. Thank you.
Thank you so much. So let's move to the last presentation of this session. We are running. I think it's
Phyllis Addo.
Yeah. Okay.
And Phyllis Addo is from University of Health.
Phyllis Addo, are you still here?
Yes, please, I'm here.
Yeah,
Okay.
thank you.
Because of internet challenges, I'm not able to put on my video, but I'm here.
Okay. So please, can you start your presentation?
Okay.
All right. Hello, everyone.
Yeah.
Just as Riley introduced, my name is Phyllis, and I'm part of...
Sorry again, in presentation mode, please. Sorry.
All right. Thank you. So I'm part of the Advanced Scholars West Africa of the Queen Elizabeth Scholars Program in Ghana. And this is one of the output of our training as a group. So I'll be presenting on behalf of my colleagues. And our work is titled Gender Roles in Food Rights and Sovereignty in West Africa. This was a rapid review. So as a way of background, we all know that it's very common to see women dominate the informal market sector in Africa. And also they take up household and family caregiving roles. Yet,
are you still connected?
70% of the food. Please, can you hear me?
Yes, that's fine. It's okay.
Yes. 70% of the food produced in Africa is produced by women. Yet they continue to face systemic challenges such as restricted access to land, financial exclusion, and limited decision-making powers. So we set out to explore the roles they play in the food system and some of the barriers they encounter, as well as look at the policy interventions needed to support gender equity in food rights and sovereignty, because these are the very people, when they thrive, communities will also do well and benefit. So for our methods, we used to understand this, we conducted a rapid review of all published works between 2000 and the year 2000 and 2023, which were conducted in West Africa and focused on role of women and challenges they faced. We sampled both papers published in English and French. And we had, we searched through standard databases such as Hinari, Scopus, and Web of Science. We screened over 9,000 studies before finally selecting 69 papers from 10 West African countries. And we use a narrative synthesis approach to look at the roles they play in the food system, the challenges they face, as well as potential policy solutions. And our findings are here. It confirms, as you can see, it confirms what many of us already know about women's role, but few people acknowledge this, that women are central to West Africa's food system at every single stage. So when you look at from food production, we usually say from farm to fork. From food production, they are playing a role till the food gets to the table, and even how they are utilized by the body, nutrition, women play a significant role in that. So let's look at the food production level. Women grow staple crops, they rear livestock, they manage home gardens. And a study in Nigeria, which we reviewed, showed that 71.5% of the agricultural workforce is made up of women. It doesn't end there. Their role doesn't end at the farm gate, but they also play major role in food processing and distribution. So when it comes to food processing, they really dominate. In industries such as cassava processing, maize, and fish production, women play significant roles. When it comes to the household level, when it comes to food nutrition and food security, women are primarily responsible for feeding families and ensuring dietary diversity and making crucial decisions about food access to the household. But despite all these vital contributions, they face a lot of barriers as listed here. So when it comes to economic barriers, women struggle a lot, as I've mentioned, with land ownership in some cultures or in some settings. Even when women have inherited lands from their fathers or families, a man has to man it, or it has to be controlled by a man. What the land is used for, these women usually would not have control over it. And one of the studies showed that while women are interested in growing more food crops, men would rather grow cash crops because of the income generating aspect of it. So there are a lot of challenges when it comes to that, especially when it comes to food security. Food crops also become very important. And agricultural decision-making, like I've mentioned, the example of growing cash crops versus food crops. Then when it comes to cultural and institutional barriers, in many of the studies we reviewed, we saw that men have full control over the household and agricultural decision-making. Economic, I missed out something on the economic. So the economic, one of the main challenges also has to do with their access to credit or loans to help them with their businesses. Also low wages. So a man and a woman can do the same job for the same hour, but they may be paid lesser than the men. One of the studies we reviewed showed that. So when it comes to labor burden and time constraint, aside working on farm, doing food production, planting, harvesting, and all the things that come with food production, they also have domestic responsibilities, leaving them little time to improve themselves or train themselves in the form of education or build their skills. And also this becomes a disadvantage or disincentive to them when it comes to having skills that will help them mitigate climate problems, while their male counterparts are getting training on new technologies and how to use new technologies to make them more resilient or mitigate these climate solutions. They may be engaged in other things and it becomes a disincentive to them. And so these challenges we can see, they are not just personal hardship for women, but they weaken food security, economic growth, and climate resilience in the
So please, could you conclude? I think you are having some network issues. Hello, Ado.
Maybe we could just move on.
Yeah, I think, Madam Rapporteur, if you are still here.
Yes, I'm still here. I think
Yeah.
she has some challenges. I don't know if you want us to pick some questions.
I don't think we have time unless I think there's another session coming on. I think it is. It's the end of our session. I think we are beyond the time allocated. We are supposed to end at 10. It's 14. I think it's not wise to continue.
We can allow two comments or questions.
Okay, thank you, Melanie,
Thank you so much.
generosity. So okay, let's go, Madam Rapporteur.
Okay, please, from our presentations, if there are any questions, we will want to take them.
Okay, I think I don't see any hands up.
Okay, so once we don't have any questions, then maybe I'll over to you, Chair.
Okay, do you have something in the Q&A now?
I see one.
Okay.
No, I think our session is ended. Thank you.
Okay, thank you so much. Bye.
Bye.
Okay, I hand it to the next chair of this conference. I think it's Melanie, by the way.
I am the next chair for this session on Indigenous Studies and Perspectives, which will be exciting because we have a special presenter who is an Indigenous leader in Africa. And I won't even attempt to introduce Daniel. I think he does it very well in his own way, and using the right language. We have to concede that we are still learning from Indigenous people how to convey ideas and and views. So without much ado, and I have a rapporteur, Salome Oyuga, who is a PhD student at Strathmore University in Nairobi, Kenya. And she's in the area of business. So Daniel, if you're ready, please introduce yourself and begin your presentation.
Yeah, good afternoon, good morning. First and foremost, I am really privileged and honored to be with you. I am Daniel Kobe I'm an indigenous person from Kenya, from a community called Ogiek. For those, I know some Kenyans even unfortunately sometimes don't know where Ogiek are. We are in Mau Forest Complex. We number around 52,000 people in Kenya. And I was privileged to have met Dr. Nicole Redvers, an indigenous person from Canada, who has been very, very useful in helping us as indigenous peoples to understand the importance of our own indigenous-led research. This is a component which many donors or faculty members sometimes ignore, unfortunately. But I can tell you this is an aspect whereby, as I'm going to talk about indigenous peoples and land issues, also in relation to health research, which is an area which sometimes has been left for conventional medicine, which most of you I know you are doing. Today, as we discuss, I'm going to really explain as a storyteller about what is happening. From a perspective of a community where I was born and brought up in Mau Forest Complex, I remember we started seeing church issues coming in 1979. We had never seen a church in Mao. We always depended on our cultural way we do ceremonies, performing things the way we knew it best. I remember my uncle chasing my mother or stepmother, in other words, in African way of describing, because of joining church and really trying to. So there are many changes which have happened. And as indigenous communities, we face many various challenges. And personally, maybe I'm privileged for having been among the first in my community to go to school. And that also made what I'm doing today. And because I know my time may not allow, I've seen the speed that your way of handling this conference looks like. I will try and share. Yes, I don't know whether it is. That is how it is.
Yeah, it's on.
It's on, okay. Okay.
But maybe you could click it on presentation mode.
Okay. Is it presentation mode really?
Slideshow, maybe.
Yeah. Is it in presentation
mode? If you
mode?
click.
Okay.
If you click on
Yeah.
or view.
Is that okay?
Yeah.
Thank you. Yeah, that is, I thought it will be good so that about indigenous peoples, and most of you in Africa, many people say, who are indigenous? And I don't want to answer that question today. Maybe if you give me another time, Melanie, I'll be able to talk about indigenous peoples in Africa, who are considered indigenous peoples. Because in African perspective, everybody say I'm indigenous, which is correct. But there are some other definition which was given by African Commission on Human and People's Rights, which are able to discuss the issues of indigeneity, who are considered indigenous peoples in Africa and in Kenya. I'm talking about the Ogieks and Gwer, many others, which I may not be able to go into details today. For indigenous people, land is not just physical property or something for collateral, but it has a cultural perspective. It is very spiritual. Of course, it is always seen as have a lot of economic foundation and connectivity. But for us, we look at it as a link with our ancestors. For indigenous people, connection to land is fundamental for identity, survival, and health. And land is a site for traditional knowledge and well-being. Don't worry about some of the photos, because they were misplaced kind of, but this is about some of the struggles which we undergo. And you could see most women are leading in the struggle. Sometimes men shy away because in Kenya, sometimes you get arrested very fast for trying to demonstrate, but sometimes women are more stronger than men, unfortunately. So land as a safe space for younger generation. There is a link which we are trying to connect. And most recently, we started realizing the importance of bringing in young generation on issues of land issues, the struggle, and research matters. Violation of land right forced evictions and grabbing and resource exploitation has been one of the greatest challenges we have had as a community. I'm talking about the Ogiek community on behalf of indigenous peoples in Africa, which most of you know. I remember in 2006, I went to support the San people in Botswana, in Ganzi, when they were being, because of the challenges they had in Central Kalahari, to try and motivate. And fortunately, I'm also an activist, so it has a lot of issues, unfortunately, because I've been doing that for many years. Displacement of indigenous communities are due to land confiscation of agriculture, mining, conservation, or forced, I call them forced conservation methods, or forced climate change issues. And also this has led to legal issues. As you can see, we were in Arusha, Tanzania, having taken the Kenyan government to court for violating and evicting Ogiek in Mau Forest Complex. And this has also caused a lot of trauma, resulting to mental health And many of the objects you find that sometimes you think they are sick, they are taken to hospital, take pressure and all those simple things. They say, oh, you are not feeling, you have no problem. But interestingly, they have a lot of problems which are related to mental issues. And this led us to do a research with some organizations, UK, and parts of Thailand and the rest. And we realized that a lot of people are suffering because they are being displaced from their home. They are no longer having that connectivity with their environment. And they are no longer having to harvest their herbal medicine or make prayers in the areas, because even in having herbal medicine, you need to make some prayers sometime before you harvest, before you give, or before you administer to the people. This all needs a lot of issues. And then, of course, we a lot of land degradation, climate change, and in our study, we came up with this terminology called solastalgia, which means the mental and emotional distress caused by environmental changes and displacement from one's homeland. I think other people say nostalgia, whatever, but this one is emotional distress, which many people, I know most of you are doctors, and sometimes you even don't know how to deal with. In some hospitals, even sometime in Kenya, people are told, go and try what we call kienyeji, means traditional way of being of treatment. So this sometimes people are saying, okay, anxiety, depression, and all this. The community, because of being deprived from their way of living, where they have been, they have had a lot of challenges. But when we did our research, we used over 50 people, and we realized many of them, of course, never wanted to talk about their stories. But after having one-to-one, we got very serious stories because of how people have been evicted. You could see that this mama and his son or daughters, how they are feeling because their house were pulled down by Kenya Forest Service or Kenya Wildlife Service. I'm sorry to talk about this because this is an academic setup. You might find it might violate how you think, but the reality is people have suffered because of distress and depression, which are caused by eviction from their land. And it's not only in Kenya. Right now, there are challenges going on in DRC Congo. It's happening in many other areas, and they are very depressing. So how will our doctors? So it is now the good part is that this opening may create a partnership where you can work with indigenous peoples to do real research. Let the people read, because many times when you come, many of those who come for PhDs, master's degrees, they want to do their research, but the community say, so what do we benefit from your research? What do we get from what you have done? Sometimes many of the scholars are unable to explain to the communities, especially because now we need what you call free prior informed consent, where we need to have that connection and say, yes, you are going to do research about my community. How are we going to benefit? How is that knowledge you are going to do going to go down or trickle down to the community? These are some of the issues. But believe me, we still believe that our forest, our setup is enough hospital, is enough supermarket for whatever we need. It will help us to even live healthy and live a peaceful life. As I've said, there are many sacred places. There are many issues which needs which we go and have sacred places. Traditional medicine remain a cornerstone of health for many indigenous communities. We can never deny that because we still make our prayers, we still have our herbal medicine or traditional healing. It's not only herbal, but there is a lot which relates to traditional medicine. We have had a lot of climate change issues, but as a community, we are now trying to find a way. That's why we have said like a way of preserving or conserving our herbal medicine and even teaching it to the younger generation so that they can benefit from the knowledge some of the elders are having, and they will be able to be helped even for future, because the older people are fading away, but who will take up the knowledge? So we have started, and we have a center in Mao, and some of you are welcome, see, especially those from Kenya, so that we can share and have partnership, bring your knowledge, we can share with you our traditional knowledge, so that we can come up with something very useful for us. I think I mentioned all this. I don't want to go deeper to that, but I wanted to tell you that as an organization, this kind of partnership with the way we are doing with Africa and Canada, I think, unfortunately, not many Africans have done research in our area like we have heard from other. We receive many scholars all the way from US. Some of the anthropologists like Professor Corin Kraft from Emory University did a lot of work with the Ogier community, many others from UK and the rest. I think most recently we have realized now Kenyans are beginning to say, who are these Ogier? What are the challenges? What is happening? And very few of them, but the number of people we are receiving now, our sender, you can see from far, and we are trying to create a place where people come and learn about our community, challenges, and stories about and we are now doing some project with the Wellcome Trust on people coming to give stories about health, about issues, and how some treatment can be done. I think I'll not wish to, because some of the things you see, we really need to have that kind of great collaboration, knowledge sharing, and we are open for scholars to come and learn of what we are doing, and you'll be able to know what land and health means amongst the Ogiek and other indigenous communities. Let me end there and wish you well, and thank you, because this is a new partnership, and I hope Melanie and the rest will give us a chance again to be able, because I usually speak to many universities outside Kenya. Unfortunately, they don't give me a chance in Kenya to tell them stories about indigenous communities. Asante sana, and thank you very much.
Thank you very much, Daniel, for that insightful presentation. I have a question myself, just to start off the discussion period. Do you actually do any exchange visits with the Indigenous people of Canada? Have you had that exchange so far?
Well, I have had, but not visiting them in their homes, but we have had meetings, because I've always attended biodiversity meeting in Montreal many times, I think 4 or 5 times. And we have had a lot of grouping with Indigenous people of Canada. In fact, right now I'm in Rome, and we are with some of them. And we exchange a lot, because we have what you call International Indigenous Forum for Biodiversity, which I'm one of the active people from Africa. And we meet with others globally, and we discuss a lot. And that is how I ended up meeting with Dr. Nicole, and I think we have called that more than 3 journals together. And I think there's a lot, and she has been really a great motivator in realizing that we have a lot. You may not need to have a lot of academic, but research is with us. We can do more because we have a lot.
Thank you. Are there any questions for Daniel? There's one from Salome Oyuga. Go ahead, Salome.
So, Daniel, I know you mentioned extensively about eviction. I was just wondering, are there organizations or efforts to reclaim ancestral land once people have been evicted, if there's really need to protect them? And has that been either successful, or what's going on in that area?
should go ahead. Melanie, can I go ahead?
Oh, yes, yes, please.
Thank you very much. I mentioned that we went to court, and in African court, actually it's a regional court in Africa, the highest ever in Africa. And we have won 2 successful landmark ruling or judgments, which have allowed the Ogiek that they are the indigenous peoples of Kenya and that the restitution should be done. The only challenge we have had, and then we even got a reparation judgment again in 2022. The first one was 2017. And we received that we should be, the court judgment should be implemented. But we have had a problem with the political goodwill in Kenya, whereby they have just been very slow to give us back our land. Some of the communities are there, but they have not been given title deed because we are asking for customary title where we'll have our community land. So there are efforts, but it has been curtailed by political interests, unfortunately.
Thank you. The next question is coming from Ivy Osei.
Hi, thank you so much, Daniel. You make mention of a lot of political backlash. I just wanted to confirm with you and if you could share some insights. What has been like the look on policy like? What are you doing with government, and what has even been an arrangement that has gone on between your community and government? If there is none, are there efforts to like create some sort of collaborative room where you could work together to get the community like going? Thank you.
Excellent question. Actually, we have been trying to create a lot of efforts using some commissions which are formed by Kenyan government, Kenya National Human Rights, the Ombudsman, National Gender and Equality Commission. We have even used some embassies, the British High Commission, the Danish Embassy, trying to negotiate with the Kenyan government to say that we should bring to an end this kind of life where we have been living in this dispensation, where we are talking of almost over 60 years of independence in Kenya, where there is a community still fighting for land rights. Actually, they found it unfortunate that they found us they found forests in our land. That's the only funny thing, is that they found forests in our land. Then it became of interest. Instead of allowing us to protect and conserve these forests, they always believe that we are not protecting. But they found us there. So there have been a lot of efforts. We are trying, international organizations, even the UN, Office of the High Commission for Human Rights, special rapporteurs on indigenous peoples globally. We have had even permanent forum for indigenous issues. A lot of interventions have been done, but unfortunately, the political interest in our country is not only in my country, but in Africa, we still there's need change, and sometime academia should also come in. I remember when we had issues, Professor Emory, Professor Colin Kratz rose to the president of Kenya saying, during our time when she was doing a research in early 70s and early 80s, the Ogiek were intact in more forests. And she couldn't understand why now you are saying Ogiek should be evicted.
Jean, you have a question?
Thank you, Melanie, and I thank Daniel. It is an appreciation to his presentation because I am Rwandan, then Rwanda is smaller than Kenya. And this issue of indigenous, or we call them people historically marginalized. But my question has been always saying, well, if people have been marginalized, when are we who think that we are not, when are we going to help them not to be marginalized? That's my first question I have been having, and then it meets what Daniel is saying. The other element of the situation is that there is no policy showing how they could be a right and equal share between the whole communities in any countries or in a county or in a district. So I see Daniel is struggling well, trying his out. So I wonder if the members of parliament whom I have seen in Kenya be more stronger than the government could play any role in that. That was my comment, and I appreciate it and thank you.
Thank you for your comments, my brother. I think those are some of the new ideas we are trying to do now. In fact, last year and part of early this year, we have been trying to get some parliamentarian to maybe bring a bill, a motion or a motion to parliament or the Senate to ask why that delay from 2017 to date. These people want a landmark case. Why can't it be implemented? And so we are using also those who are, because there are those who are pro and those who are beneficiaries of Mao who don't want the Ogiek to really get back their land. So we are trying to use every effort. We were hoping maybe we'll have gotten a chance with the African Union. Unfortunately, we didn't. Maybe we will have asked, because we have been also trying to use the African Union to push, because if they are the one who came up with the African Charter or the protocol, they should really support the OGIEC to see that the implementation. Otherwise, there is no need to have a whole regional code, and it is not being respected by the members.
Correct. So we really do need to go to the next speaker, but if Salome, your question is quick, I will allow it.
Thank you. It was just announced looking at the individuals affected, Daniel, in terms of access to healthcare services that can address the mental issues and the depression that they are going through as coping strategies, even as we're looking at the bigger solution of reclaiming land or rather resettling them. Vis-a-vis their willingness or their life in terms of embracing modern approaches again to dealing with depression and mental issues. Just wanted to pick your mind or your insight around that. How is that happening at the community level?
That's an excellent question. I think it would have been wrong if we never had this question. Because sincerely, one of the issues is there's also poverty. For these people to meet maybe a psychiatrist, those are high level in medicine, to meet those people. So the only way we found was people to share their stories. In fact, we are going to a new project with Welcome, where we are going to allow most of our people to tell stories. Somebody to tell you how he lost this number of property because of eviction, or this kind of problem because of this. But still, we encourage them. And we are actually partnering with some hospital in Narok, Nakuru, trying to allow them that please go to hospital because some ailment can be treated. But we found one of the greatest support is where people are able to share their stories. And then we tell them there's still hope. So CCLTs are something we should talk more. And we have done a lot, and there's some lot of documentation I'll share with Melanie so that it could be also useful for some of you. Thank you very much, Salome.
We will have more discussions. If Ivy, you keep your presentation concise so that we have a comment by Daniel too on your presentation. So Ivy, go ahead.
Hi everyone, sorry, can you see my screen?
Yes.
Okay, thank you so much. So into this presentation, I'll be providing some context on a research that we conducted on the formalization process of South Africa's indigenous games. And in this presentation, I'll provide some context, the methodology we used, some of our findings and what they mean, what future research should be looking at, some of the key takeaways and reflections from the study. So to give some context, this study was situated within post-apartheid South Africa, where the revival of indigenous knowledge systems, including indigenous games, have emerged as a key element in the nation's culture and social reconstruction. And as such, many indigenous knowledge pioneers have called for the revival and development of indigenous games, which have led to efforts to formalize the games within, which has led to efforts to formalize and representation of the diversity within South Africa. Others also think that it's a neo-colonial rhetoric where the trappings of modern competitions could be aligned with these games, which could pose a risk to their cultural authenticity. Therefore, we used resource narrative analysis to trace the evolution of the games, exploring in detail the actions and tensions that came forth while integrating them into formal institutions. And in this research, we position indigenous games as a new institution that has been created within South Africa's sporting landscape. To better understand the evolution phases and the formalization processes, we adopted Lawrence and Sotheby's institutional work theory to examine what and how different stakeholders played a part in creating and enacting policies within this new institution. For our methodology, we examined 24 policy documents and research reports spanning from the years 2000 to 2024, which offered insights into the historical evolution of policies and the structures that has been established. We also conducted 4 semi-structured interviews, which captured the thought processes of stakeholders involved in the formalizing processes, and these thoughts were not captured within the documents. And for in-depth analysis, we use get-stick description to move the surface level interpretation of the data to really capture the underlying meanings and subtle details and intentions in the data that we collected. So for our findings, first, we found that recreation was seen as a first world invention by marginalized South Africans who did not have access to sports. And so one of our research participants mentioned that people were not engaging in physical activities anymore. So as part of getting everybody to exercise, the government created what we call the South African National Games and Leisure Activities, which is Sangala, which included both mainstream sports and indigenous games. And then a direct order came from President Thabo Mbeki, who is known for African Renaissance, for the revival of indigenous games in 1995, which was intended to create what they call a truly African recreation identity. So the government, in collaboration with research institutions, began documenting and classifying the games based on their history, their cultural functions, and the values that children and elders ascribe to them, to ensure that there was intergenerational knowledge transfer and create some sort of awareness. And the classification led to the creation of standardized rules and structures, ultimately leading to the creation of the South African Indigenous Games program at the local and provincial level, the National Indigenous Games Festival, and South Africa's participation in World Indigenous Games. Aside the creation of structures and programs, we saw intentional efforts to embed the games in existing institutions. So for instance, indigenous games were included in community sports and school competitions. And our participants said they weren't alternative sports or lesser known sports, but they were equally important sporting opportunities. And there were also efforts to valorize the games, like the creation of an award system. And so while we thought the award system may align with mainstream sports standards, which prioritize winning and competition over traditional values that these indigenous games teach, the participant argued that the award system was a driving force to increase participation and honor the talented athletes. We also saw a lot of policy work to ensure the operational stability and widespread recognition of the games through the creation of an organizational structure, the push for them to become federations, and a lot of manuals being created, which could also pose a risk to their cultural uniqueness in the games and even cause homogenization. Again, we saw a lot of changes in sports within South Africa. For instance, there was a lot of disconnecting sanctions from what indigenous games is known to be. Thus, from players being their own referees to deciding the directions of the game, to external referees to control the games. And also the games have moved beyond the intrinsic communal values to performance, competition, and specialized equipment. But our research participants also referred to the fights between Okonkwo and Amalinze, if you've read the novel Things Fall Apart, as a symbolic reference to the competitive nature of indigenous games, even in their informal structure, and that the games have always been competitive, just that the way it is being controlled now has changed, which should not be seen as a risk, but it should be seen as the dual role of indigenous games to serve as dynamic carriers of cultural knowledge while navigating its way to stay relevant within contemporary society. The findings also show a lot of dismantling of dominant association of recreation to Western sports like rugby, like football, and also their inclusion in the educational curricula, which emphasizes indigenous knowledge as valuable and legitimate forms of education to resist the perpetuation of Eurocentric educational frameworks. Again, we saw a lot of indigenous games having the potential to be blueprints for navigating not just sports in the participation in sports, but also in sustainable development through sports in Africa. So our findings show that scholars should really move beyond the binary view of formalization as inherently good by creating opportunities of legitimacy or bad through the risk of commodification or homogenization, but to see it as locally adopted, negotiated, or resisted. And so as South Africa navigates its post-apartheid identity, I think the story of indigenous games will continue to evolve. So future research should go beyond policy documents and official pronouncements to really ask questions about how does indigenous voices shape policies in the games? What is the operational stability of the games within national sport frameworks and even their effectiveness in community centers over time? What similarities and differences exist among other indigenous game initiatives like the North American Indigenous Games? How do we learn from them? And research should also include what accessible opportunities exist within the new operations for people with disability. We think that Africa's indigenous games have a role to play in shaping the sport landscape of the continent and repositioning Africa's sporting prowess on the global stage if formalization is done well. And successful formalization would lie in collaborations that foster mutual respect for knowledge holders and experts, flexibility and adaptation, shared decision-making, and a constant negotiation of culture with community leaders. And this way, we think just like our research participants envisioned, there could come a time where the rest of the world will catch on and be enthusiastic to learn about our games, like in Kuva, like Ampe, just as we celebrate games like ice hockey, lacrosse, and cricket, with the deepest respect of their cultural expressions. Thank you.
Melanie, you're muted.
Oh, I'm sorry. We can take about 2 questions from participants. No questions, no comments. Salome, there are some comments and questions in chat. Would you like to read them? You're muted, Salome. Salome, did you hear me? My rapporteur.
Yes, I've heard you. I've just opened the chat.
Yes.
To read the questions. So there's a question here. Indigenous games of Africa is a significant study area where South Africa and Ethiopia are leading. But this is really more of a comment than a question to you. So they are raising similar studies or comparatives between South Africa and Ethiopia. That could be a potential area to look at. And some regions in Mount Kenya within the coastal region as well in Kenya. as areas that could also be considered. So it's a general comment on the work you've presented, Ivy, as areas that could also be researched.
Okay, thank you so much to Daniel and Ivy for
Maybe
this
you
very,
have not
very...
seen my hand, please.
Oh, sorry. No, I hadn't seen it, Dr. Wanderi. Go ahead.
Yes, I had first of all given this chart so that a follow-up can be done. And I'm very happy I happen to have done a substantial amount of research on traditional games in Kenya, but also I've written several documents on about traditional games in Africa. And I'm very happy that Madam Ivy is here telling us about traditional games. What I have observed in the past is that the older persons who are in academia for a while, we tried to talk about it, but I'm happy that we have now younger persons, the younger scholars coming up with it. All I would request is that we give them support, and I am happy the forum has availed that opportunity. In the area of matching up areas of interest, I'm very much aware that there is a lot of traditional games also done elsewhere, and I will be ready to link up if it is possible with Madam Ivy so that we can pick up on this. I also appreciated the earlier person who talked about the indigenous activities within various communities in Africa. Well, these are areas that we need to preserve and write them up and preserve them. So I give my word of compliment to Ivy that she has developed that interest. Let us move on and preserve what is our own and what was neglected and what was left to die off. It's not yet gone. There's still some hope for perpetuation. Thank you, my submission. Professor Wanderi, I am a professor, associate professor at Mount Kenya University in Kenya. Thank you very much for this opportunity.
Thank you very much, Dr. Wanderi, also for attending the conference. I will now move this session to the next one, which is a young scholars roundtable that is that is chaired by Masa Tarawale. Masa, would you like to take on?
Yes. Okay, good afternoon, everybody. So we are now going on to the roundtable discussion, and it is going to focus on the African Young Scholar Coalition. This is going to be the flow. We'll have our main lead discussant, who will be Bridget Ofosu Adam. She is currently the chair for the Black at Western University Alumni Association in Canada. So she's going to be our lead discussant. And after she is done, we are going to have 3 representatives from the African Young Scholar Coalition to give us their response and feedback as it relates to mentorship and collaboration. And then we'll open the floor to everyone else to give, if you have a question, if you have a feedback or a comment that you would like to share. So on that note, I'd like to welcome Bridget to share her presentation, which will focus on empowering African descendant students, the role of alumni network in career advancement, academic success, and global scholarly initiatives. Bridget, over to you, please.
Thank you, Martha. Just going to make my presentation. Sorry, just trying to navigate this. Okay, I think. Okay. All right. So hello, my name is Bridget Andam, and I am happy to be a part of the inaugural.
Please adjust your mic. Adjust your mic. You're very low.
Very low. Can you hear me now?
It's still very low.
I wonder why.
Maybe you want to take it close up to your mouth. I don't know if that works.
Actually, I use this mic all the time. I'm not sure what. Can you hear me now?
Yeah, it's much better.
Much better now?
Yes.
Okay. Okay. Sorry about that. So my name is Bridget Oposu Andam, and I am happy to be a part of the inaugural Canada-Africa academic collaborations. As a scholar in Africa Institute's Canada-Africa Young Scholars Coalition roundtable to discuss scholarly initiatives between Canada and Africa and the importance of experiential learning. I am based in Alberta, Canada, and I'll be discussing the importance of empowering Afro-descendant students, the role of alumni networks in career advancements, academic success, and global scholarly initiatives. Okay. So for today's agenda, I'll discuss my background, empowering Afro-descendant students and the role of alumni networks in career advancement, and of course, global scholarly initiatives, experiential learning. Okay. So I had the opportunity to be a part of a few global scholarly initiatives like traveling to Italy, Dominican Republic, and Ghana, which gave me the opportunity to explore. As chair, I work with executives to ensure that Black at Western alumni is functioning at its full capacity.
Just a second, please, Bridget. I'm sorry, but your mic is still low from the comment we are receiving. Can you adjust your earphone, please?
Okay, sorry. Let me unplug it and plug it back. Okay, is it better now?
I think so, yeah.
Just gonna look at the audio and see. External headphones.
Can you try to use your computer mic?
Can you hear me now?
Because maybe your earphones or whatever you're using is interfering with sound.
Now you're loud and clear.
Now I'm loud and clear. Okay. Okay, perfect. Yeah, I realized that it did not connect the microphone part, so I'm so sorry about that. So I'll start over. I had the opportunity to be a part of a few global scholarly initiatives like traveling to Italy, Dominican Republic, and Ghana, which gave me the opportunity to explore. As chair, I work with executives to ensure that Black at Western alumni is functioning at full capacity. Our focus is to advocate for Black students and to promote networking as a form of career advancement and knowledge sharing. I graduated with an honors specialization in social justice and peace studies at King's University College, Western University. And I'm currently completing a Master of Education, specializing in educational leadership with a strong focus in anti-tokenism and effective leadership. This focus is passionate to me because we find that many racialized folks are more so Afro-descendants may find themselves in academic powerful positions, but may find it difficult to be effective in advocating or being a solid representation for Black folks or Black students. Hence, I am working on a paper to discuss these topics and a comparative analysis of EDI strategic plans and if indeed it works for Black students or if it is performative. This is definitely a challenge I'm looking forward to navigating and hopes to shape policy. As ED for Developing Communities Everywhere organization, we focus on empowering students, marginalized folks, low income, and racialized communities. Through this organization, I created a racialized youth research committee that focuses on discussing research ethnic social issues. We had the opportunity to win a Power of Youth grant by the Michael Jean Foundation and created two events, which is navigating institutions as a Black individual and navigating institutions as a Black individual community space, where we discuss the barriers Black folks or Afro-descendants faced when navigating these institutions. Folks discuss their struggles in navigating healthcare and educational institutions the most. So to find out more about this initiative, you can just go on www.dceorganization.org or on our Instagram at DCE_organization. Okay, so I want to talk about empowering Afro-descendant students and the role of alumni networks in career advancement. The presence of Afro-descendant alumni on university campus is crucial in fostering a sense of belonging and support for current Black students. It is important that BAWA, Black at Western Alumni, continues its course ensuring that Black students have support on campus and that they are connected when they graduate in hopes of securing employment or seeking career advancement opportunities. The historical and cultural ties between Canada and Africa present a unique opportunity for Afro-descendant students and alumni to engage in academic research, international collaborations, and knowledge exchange. Universities can play a pivotal role by supporting initiatives that promote academic mobility, global networking, and community-based research. That addresses issues affecting Afro-descendant populations across diaspora. I'm proud to mention as chair for Black at Western that we have a BAWA bursary campaign, which we're soliciting funds for Black students on campus that are struggling in their day-to-day studies. Okay. During my undergrad at King's University College, I had the opportunity to travel to Tuscany, Arezzo, to be a part of a social justice-based course that focused on learning about the dangers of migration, borders, and displaced migrants along the Mediterranean Sea. I studied at the Cittadella della Pace School of Peace that focuses on reducing armed conflicts around the world and spreading its own method for the creative transformation of conflicts. I was also exposed to learning the Italian language and learning about the Italian culture and stayed in Italy for 1 month. I also had the opportunity to travel to the Dominican Republic to learn about the dangers of mining and its implications. We traveled to Rio Blanco to learn about the coffee plantation, the environmental degradation due to the mining that was taking place in Pueblo Viejo. It degrades the vegetation, causing cancerous reactions in the body, and decreases the quality of life due to the cyanide that is sprayed in the air when processing the gold. We also visited Ascala, which is an organization focused on defending human rights and empowerment through personal and social development. We learned about anti-Haitianismo, which is a racist notion that suggests discrimination and segregation of Haitians in the Dominican Republic. More so, xenophobia, which is the dislike or prejudice against people from other countries. Many Haitians are not given citizenship in the Dominican Republic due to their nationality and skin color. This really helped me to understand the importance of experiential learning and the ideology of being a global citizen. Lastly, when I was completing my practicum, I had the opportunity to partake in the GISEL, which is the Global Citizenship and Equity Learning Experience. Which is also a global and domestic service learning opportunities for students to develop leadership skills and create positive change in our interconnected world. In this program, it emphasized in the conceptualization of global citizenship, making a difference on a global level. I was selected amongst applicants to travel to Ghana and develop youth programming at a rural educational institution. After assessing the children, a thorough assessment, I created 3 programs, which was the English Reading Program, Homework Club, and an English Reading Advancement Program. I stayed in Pram Pram, Ghana for 3 months, and it definitely shaped the way I perceived the world and was a humbling and inspirational experience. More so, during International Development Week in February, well, this month, DCE organization organized International Development Experiential Learning and Classroom Spaces. During this event, we invited teachers to discuss the importance of experiential learning and their knowledge on students interacting in the classroom and outside of the classroom. We discussed the importance of teachers providing accommodations for students who are unable to participate in experiences and for educators to implement cross-curricular approaches and the importance of collaborating with community leaders to address systemic barriers in classroom spaces. So you can see in this picture with the greenery behind with my afro, you'll see that I was in the Dominican Republic and I was in Rio Blanco. And in Rio Blanco, they have a coffee coffee beans processing center, and we learned that the mining that was happening in Dominican Republic was affecting the vegetation and the prosperity of the people in the Dominican Republic. And also you'll see a picture of me just standing, and you can see the landscape. So that was me in Italy. And then also you see at the bottom is a picture with me and two children where I was an educator. And so with all this information, I just wanted to emphasize the importance of global scholarly initiatives and the importance of experiential learning for students. Thank you very much to chair, co-chair, and organizers for giving me the opportunity to speak. And I will just give it back to the chair. Thanks, Masa.
All right. Thank you very much, Bridget, for that insightful presentation. We have learned so much from the amazing work you are doing in the community. I know I've partnered with you on certain levels. We are going to give the floor to the three representatives from the African Young Scholar Coalition, Diomarco, Emily, and Sola, to give their feedback, comment, or response to what you have shared before we open it up to the entire group to ask questions. And if you have questions in the meantime, you can put them in the chat, please. So I will call on Emily, please. Emily, you are muted, please. Yeah.
About that. Sorry about that. And I just said thank you very much, Masa, for the opportunity and the organizers. And thank you, Bridget, for sharing with us your story. It's very inspirational. I like that you unpacked some very critical concepts, especially about global citizenship and, being a global scholar and just understanding how your personal actions and decisions influence people at a larger scale. And indeed, when you spoke about mentorship, I felt that is very, very important, because when young scholars get other experienced scholars to be able to illuminate their way, to be able to guide them, to show them the different, paths, it affects how you think, how we look at issues, and it also affects our actions. So I really think your experience is one experience that we can learn from, and walking us through your own personal journey, the things that you saw, what you learned, and even showing it in terms of the pictures. I love how you introduced your presentation. You told us your own personal stories that we really could connect with, and went ahead now to be very specific about how you learned yourself, what you have been able to do, and we can practically see what you're doing even with the young people. So indeed, the work that you have done and the impact of the mentorship that you got, and also just changing your mindset and how you think, has really had a good impact that I think for young scholars and even those that are aspiring can really, really benefit from. So key takeaways, for me, I don't know whether I summarize everything or I could just give a few comments and then I can speak about others later.
You have 2 minutes. Yes, please.
Oh, I have 2 minutes. Yeah. So thank you very much. I think the other thing I also learned, which I think is very important, is thinking beyond the culture where we live. That how do we adapt to other cultures? And how do we think beyond our own context where we live? Or rather, even as we think about our context, how can we think globally? How can we think about how our actions, how our research studies, how our scholarly work is going to impact the globe and impact other people? And then how can we mentor other people to be able to take these positions? The intergenerational conversations, the intergenerational discourse, thinking about safeguarding our environment, thinking about social, I like that you brought in the issue of social justice, which is also very, very important. That is your subject of study. However, it relates with all of us, because if you go to a foreign country, for instance, what are some of the coping mechanisms? How would you be very successful? You are able to give us those insights. And I believe this is really, really, useful for I as a person and for the rest of the young scholars, that we can pick lessons, we can hold on to other people who have been successful for research support, for sharing knowledge and experiences, and also just illuminating issues that will really have an impact in the globe, just like what you are doing. And indeed, that movement is going to impact a lot of people. Masa, I'd like to pause so that I give a chance to others to speak.
Yes, and you have more time when we open it up for questions. So thank you very much. Can we please have Sola? You can also speak to some of the things that Bridget has presented on.
Hello?
Yes, hello. We can hear you.
Okay, thank you very much. I think globally, there are challenges that young ones are going through, and then they look up to people that will be able to actually help them to overcome these challenges. And then mentoring is inevitable. And this is a good aspect that when young people have persons to look up to, it's really encouraging. Many of us are falling into some challenges at tender age. We try to maneuver our ways to achieve what we have achieved today, but it would have been easier if we actually had people to mentor us and to show us how to cope with life challenges. And this is a good thing that you are doing. I think I want to look at it from that perspective, that we need more persons on board to see how to work with young people and do mentoring, and also being a kind of life coach to be able to help them to achieve their future. I want to say thank you for this contribution to knowledge, and we'll say it's a good one from your end. Thank you.
Thank you very much, Sola. And Diomarco? Hello, Diomarco, are you there? Yes, please.
Hello.
We can hear
thank
you.
Thank you to the Africa Institute and to the Canada Africa Young Scholarship for this opportunity. A big thank you to the biggest for you for your so provoking presentation. I'm Jumokor. I work for machine learning for climate change and methodology. My question for business is, why do you think, for example, the challenge for machine learning for the young research in Africa collaboration, if, for example, the using machine learning collaboration can, for example, ameliorate the research in Africa, African solar seed. For my English. And I am also interesting for example, this collaboration to, if there is in the group people who work for the climate change and meteorological, I am interested to collaborate with add my knowledge and partaging my knowledge for different collaboration to resolve lot of challenges in West Africa for climate science and meteorological research. Yeah, thank you.
Okay. I'm just trying to understand the question. Are you able to just ask again so that I can give a good answer for you? I'm hearing collaboration. Is that what you're asking? How can we collaborate with folks who are taking on experiential learning, or is that I'm trying to understand your question, sorry.
I see, for example, what machine learning method you say actually the intelligence artificial method is using for how he can ameliorate your, for example, your research your research in the Africa Institute and in the Canada Africa Scholarship. If you see the opportunity of machine learning in your research future.
Okay.
Yeah.
All right. Amasa, if you're able to also help. Yeah.
Yeah, so I think, Bridget, I think the question that Diomarco is trying to ask, it's in regards to how do you see the effectiveness of the global initiative, like in Africa, right? Student being here and being educated in the Western world and going back, and those collaborations, do you think they are effective? I think that's where his question is coming from. And is there room for people who are looking at like climate change or anything that has to do with environmental studies?
Okay. Yes, I would say definitely experiential learning is very effective. It definitely opened my mind and my perspective when it comes to the different types of or the different methods of learning. For myself, I am more of a practical person. I need to be in the field, I need to be active, and in that way, I'm able to grasp whatever I need in order to work effectively in my field. And so I would definitely say that students who choose this path will definitely see a big difference within their educational journey. So I think that it is very important, and it is a wonderful opportunity. In terms of climate change, for myself, I did not really delve deep into climate change topics. However, I took on the opportunity to learn about the various social justice issues that were happening in the countries that I was traveling to. Like, for instance, in Dominican Republic, there is anti-Haitianismo, which is the whole idea of pretty much discriminating and discriminating against Haitian folks, and also xenophobia, which is the dislike of somebody from another country, right? So that's something that I witnessed a lot in the Dominican Republic. Like, even as a group, I remember I was traveling with another African student, and he had very strong African like features. He was darker skinned and everything, and they didn't even want to allow him on the bus that we were on, right? So that to me was like a serious reality of who we are, and how we're perceived in the world, right? As even Black people. So it was definitely an eye opener for me, and it was a good experience for me because it helped me to understand what my positionality is as a Black young scholar, right? And how I am perceived navigating these global systems, right? So yeah, I hopefully that was able to answer your question a bit. So
yeah, well, thank you very much, Bridget, and the team. Because of time, we're going to move to the next session. But Bridget, you can put your number in the chat and your email contact. Maybe other students might link up with you in regards to mentorship and collaborations. Thank you so much. Over to you, Melanie.
We are over time. We apologize to the sessions coming up. And the next one is infectious diseases, being chaired by Dr. Margaret Mutumba. Please, could you introduce yourself, because we didn't have enough time for people to read this screen. So if you could introduce yourself and your rapporteur as you take on the session.
Hey, excellent. Thank you so much for this invitation and for sticking with us. My name is Margaret Mutumba. I'm the Program Director for the Frugal Biomedical Innovations Program here at Western University. And we have been working collaboratively and successfully with many institutions in Africa to develop low-cost medical technological devices and innovate and commercialize those devices. And so if this is an area of interest, we invite you to connect with us. And I'm also excited to chair this session on infectious diseases with Peggy Eboko, and we are looking forward to some really good presentations that are coming up. And so without further ado, I invite Asua Letitia to present your work on vaccine equity to the group. Thank you. I hope you're here. If you are, just unmute and have your camera on if possible. Is Letitia here? Asua?
If she's not, I think we can move to the next one so that maybe she can come after if she's here.
Sounds good. Okay, excellent. So we are pleased to now move over to our keynote speaker from this morning, Dr. Abe Otson. You are welcome to present on your work in HIV prevention in Kenya and Canada.
Thank you.
Are
I'm
you
just
here?
going to
Yes.
share my screen and make sure it is in presentation mode. All right. Well, thank you for having me back on. And I will be succinct because I've already had time in this busy agenda. Just to give a couple highlights of the work on peer navigators. And so, again, for those who weren't on this morning, first thing, this is a collaboration between Kenya and Canada with a model that was first piloted in Kenya and then generously shared with us in Canada. I'd like to acknowledge CIHR as the funder, the Canadian Institutes of Health Research, for this phase of the work. So it was a 6-year project, and the idea is to help reduce both new infections of HIV as well as to support the long-term care and treatment of those with HIV with a focus on street-connected youth. We had 3 intervention sites in Canada, in London, Toronto, and Vancouver, and 3 Kenyan sites in Eldoret, Huruma, and Kitale. And in terms of the model of peer navigation, it was important to us that the peer navigators be an official role. And so that was to have them employed within an organization, a community-based organization or a hospital-adjacent organization, to ensure that they had all the rights of any other employee and not simply be sort of a research staff member, but actually be integrated within existing health teams and services. So the peer navigators, it's an interesting challenge that we faced, is sort of thinking about what constitutes a peer across multiple identities. And so we're thinking about youth, we're thinking about people who are street connected or homeless, and we're also thinking about people living with HIV. Additionally, in the Toronto and Vancouver studies, there was a focus on 2S LGBTQ youth. And so in that way, then, well, what makes someone a peer? Do they have to have all of those identities and experiences, or is one or more sufficient? And we had the good fortune across our sites of hiring peers who had both lived experiences of homelessness and living with HIV. We had agreed that that the experience of homelessness was our starting point, should we have had to sort of make a decision. However, we didn't have to make that decision. In terms of youth, we focused on those age 16 to 29, which I know is a pretty broad definition of the concept of youth. However, we know in the context of being street connected that folks often have a long trajectory before they perhaps stabilize in their lives. So I wanted to just highlight a bit about what we learned about the peer navigators and that role as we were implementing this. The first thing we had to sort of think about was our funder was particularly interested in our metrics around testing and connection to treatment. And so, they would have been very happy if our peer navigators were just out there getting testing for everyone and getting them into appointments. But in knowing the complex experience of living on the streets, we know that if folks are experiencing violence, partner violence, violence from people taking advantage of them, if they are experiencing deep poverty, food insecurity, that all of those things take away from their ability to manage their health. And so we gave a pretty expansive role for the peer navigators so they could really manage any aspect of support, such as providing transportation to other services, referrals, accompaniment to appointments, not just health appointments, social care appointments as well. And either directly providing some counseling as they were able, or connecting them to those services as well. So pretty comprehensive role for the peer navigators. A lot of training involved in supporting them in doing those roles. So very, very large training program. So what did we find was their experience within the teams? Well, we found that there's generally a shared understanding of the idea of peer support. So that's a good starting point for integration in the teams. And teams recognize that a peer navigator might do things differently than other members of their team because of their lived expertise. However, there were still challenges within the teams. And so folks who were peers were maybe not paid the equivalent wage of others within their program. Were sometimes found that if they introduced themselves within other services as peer navigators, that they maybe weren't treated well by such folks as hospital staff. So would sometimes just introduce themselves as a member of such and such an organization rather than disclosing themselves as peers. And that leadership in different organizations maybe did not buy into this as a fundable model. So I mentioned in London, we had the peer navigator turned into a permanent position. That wasn't the case in all of our sites. So in terms of the value, one of the street connected youth says, within the ways of understanding what I'm going through, most workers I have are like, I don't get it. And it's like, dude, well, if I have to sit here and spell it out for you, there's no point fighting anymore. It's just going to take a lot of my time and I don't need to take up. And the peer navigator is already knowledgeable about it and knows the risk of stuff, and she seems to know what really you need to work on. So the sense that having those peer shared experiences expedites the care that a peer navigator can provide because they know some of what the person's going through. The big issue we found in terms of peer navigator needs was around boundaries. And so because of the diverse expertise they bring to that, there were high expectations, both from the organization and what organizations think peer navigators can accomplish, as well as expectations from the street connected youth themselves of what the peer can do for them. There's also a lot of sort of blurred overlap in terms of relationship. These peer navigators often had sort of mutual networks of connection with the street youth still, even though some of the peers themselves were maybe into their mid or late 20s. And so that can be really difficult. We had some very difficult interpersonal situations where the youth were sort of pushing the boundaries of peer navigators in terms of their personal lives and making it very hard for the peers themselves to disconnect after hours from the work. So we did look a lot at helping the peers to take care of themselves and take care of their boundaries and their own well-being. So the peer navigator, one of them says, and so that means that I have boundaries around my work, which also means I've noticed a bit that it also affects some of the relationships with clients, because clients can take advantage of the fact that you're a nice person and willing to go above and beyond. When you suddenly aren't able to do such and such a thing, they see you a bit differently and can treat you a little bit differently and think that you're mean or whatever. So navigating that has definitely been something that I've come across, like a necessary growing pain. So we did do a lot of work around supporting peers, and we created in different communities support networks of, so our peers were working obviously in HIV care with street connected youth. There are peer workers within the broader HIV care system, but also within other social services. And so we were able to create some local networks of peer support workers so they could talk to each other about that role and what that role means. They could help support each other and then help each other also advocate within their organizations to have those roles valued, have them properly compensated, and integrated within the teams. So that's all I wanted to point out right now. I invite you to check out our website. I'll put it in the chat in a second here, pmpstudy.net. We have some guide documents for folks who are interested in this sort of peer-based work, and also link to some of our scholarly articles that have come out of this project, on one of which this presentation is based. So thank you for your time and for your interest in our project.
Excellent. Thank you so much, Abby, for that more comprehensive presentation and building on to the discussion this morning. I would like to invite perhaps 1 or 2 questions since we are behind time. If there's any audience questions, feel free to unmute or perhaps put it in the chat if you're not able to. Do we have any questions yet?
I had a question.
Yes, you're welcome to ask.
In the point you made about perception, where they might be seen as not as valuable as other members of the team, especially when they're in hospitals and so on, so they use different introductions. I'm wondering if this might have long-term implications. So short-term, it might gain them access to the hospital easier and sort of less friction. But long-term, it is also an acknowledgement on their part that they value less the peer title. So I'm wondering if this is sort of a situation where we might be shooting ourselves in the foot 10 years from now, for example, when we're trying then to destigmatize it or reduce the tokenism. But it's incredible work. Thank you very much for this.
Yeah, no, that's a great point, and I absolutely agree with the point. So I should be clear that this is our evaluation sort of towards the end of the project when we were learning from the peers about what they had been doing. So it wasn't our recommendation to them that they sort of hide their title or present themselves in a slightly different way. It was what we heard from them that they had been doing as sort of a problem solving in the moment, is they would say, you know, I'm so and so from the health unit, instead of saying I'm so and so the youth peer navigator or what have you. So yeah, I absolutely agree. I think it's a act in the moment to accomplish what they're trying to accomplish with the youth that they're supporting, but it doesn't help the whole sector value peers in the long run. So yeah, absolutely.
Thank you so much for that question. Hisham, do we have another question for Abby? I really enjoyed that presentation, and I think it really captured the complexity around delivering interventions in communities that are very quite tight-knit. And I was reflecting on your point around boundaries and being able to switch off and disconnect. And for instance, at the closing of this program, how are we thinking about privacy? Because the peers, I'm sure, now have access to very sensitive information from the cohort of young youth that they're supporting. What does that look like in terms of privacy and perhaps the ability to use that very delicate information in the future, perhaps for reasons that might not necessarily be positive?
Yeah, well, thank you. That's a really good question. So One of the benefits of ensuring that the peers were hired into existing organizations is that those organizations do have their policies, such as privacy policies, that both help protect the peer navigator as well as protect the youth that they're working with. But we did see a couple real examples. You know, as a nurse, these are things that we've in our sector wrestled with anyway. So a nurse working in a small community, for example, has these challenges in often knowing all of her patients and or his patients and families. So there are good guidelines around that, but we did have a particularly difficult case where our peer navigator in her personal life became aware of a child safety issue. So she was aware that one of the youth who she was supported was not caring in a safe way for her child, and she learned that information outside of the clinical context because of her immersion in the community. And so that, of course, creates really complex because there's actual legal sort of requirements around child protection. But is a strong example of that the boundaries between personal and your professional lives. So again, fortunately, we're able to lean on policy that exists within organizations. For our Kenyan-based folks, all of their clinics had hospital affiliations, and so those hospital policies addressed privacy. Does policy protect in the real world? No, not necessarily. Our peer navigators also received pressure because it was known that they had compensation for some aspects of participation in research. And so people also leaned on them for access to money in ways that became difficult at times. So you know, policy is the best we can do in protecting and constant communication and debriefing when policies aren't working. But yeah, without having those organizational policies, I don't think we could have created a safe enough environment just doing it on our own.
Mm-hmm. Thank you so much for that sincere reflection on this work. And perhaps if there are no other questions, I would just like to give a virtual round of applause for our presenter today, Abby. And I'm happy to hand over to the next session.
Thank you, Margaret. That was a great session. The next chair is Dr. Kandala.
Yeah, hi everyone. I know we are already late. This is the last session on communicable diseases. So I'm Nyanga Bakwin Kandala. I'm based at Western, and I'm going to be supported by Rapporteur Emmanuel Acheampong. He's also from Western. So we have 3 speakers. I don't need to introduce them because they have been keynote speakers and co-chair. So there is Pauline, based in Nairobi. There is Asham from the University of Chicago, and there is Masa, also from the University of Windsor. So they're going all to be talking about non-communicable diseases. As you know, Africa is known for communicable diseases such as malaria and so on. So chronic diseases such as cancer, hypertension, diabetes has not been highlighted enough. So we have the opportunity for them to talk about this, and also especially the mental health aspect of that. So I will go and then have Pauline as the first speaker, please. Over to you, Pauline. Is Pauline there?
Yes, greetings. I'm there and I'm trying to put my presentation, but it seems there's one still on. Let me just put it again. Okay.
You should be good to share now.
Yes, I'm now able to share. Yeah, greetings and good morning, good evening once more. and our paper this evening is on evidence-based interventions for healthy lifestyle behaviors to reduce non-communicable diseases in slums of African cities. We looked at 4 slums in African cities and London, Ontario. So when we talk about evidence-based programming, it's an approach that is based at looking at programming aspects in terms of sustainable and effective ways of improving project performance. So we try to look at projects that have been designed with the element of EBI, that is evidence-based intervention. And when you talk about the evidence-based intervention is scientifically tested and proven effectiveness through rigorous research and evaluation. So we looked at programs that have been effective in terms of reducing the impact of non-communicable diseases, especially in informal settlements of some of the African cities, that is Nairobi, Uganda, South Africa, and also in Ontario. Now, the rationale for us looking at this is because according to data from health information systems from the various countries that I've mentioned, the burden of non-communicable diseases have considerably increased. That is from the high-income countries to middle-income countries, that is the LMICs, and it contributes to 41 million deaths annually. So there's been change because of the rural-urban migrations, where you find that based on the lifestyle changes, because most of the time when there's that aspect of rural urban migration, even the dietary diversity changes, meaning that you find that families are able to get foods from even less than 2 food groups, thereby impacting their nutrition status negatively. And there's been a prevalence of type 2 diabetes, which has increased rapidly. That is from 5.4% in 2017 all the way to up to 27%. And this has really impacted the lives, or rather the health, or especially for women. And we also find that high-income countries such as Canada, evidence also suggests that immigrant populations normally experience higher non-communicable disease rates than the host population. And some of these disparities are also based on the quality in terms of diet and also exposure to exercise and other aspects. And based on these issues, we identified some of EBIs, that is the evidence-based strategies that can really help in terms of modifying lifestyle behaviors to combat non-communicable diseases. And remember that the reason why we were looking at the evidence-based interventions is that they are already scientifically proven and they are data-driven, that they can be able to support in terms of averting some of these issues. And some of the evidence-based interventions that we looked at, for instance, are the fact that improving access to and consumption of healthy foods through studying approaches such as supporting community gardens and expert-led nutrition, health education in urban slum areas. So we were able to identify programs in some of the informal settlements and the slum areas that have been proven to be effective and also to be feasible. And we're also looking at the element of replicability. So some of these interventions that we were studying, we looked at countries that have been able to implement some of the strategies, and if they can be replicated or even scaled up in some of the informal settlements. So when we looked at even the element of the physical activity, by adapting and implementing programs such as Actipass by Helia in Canada, which has also worked. We looked at some of the programs that is Western Cape on Wellness, WOW in South Africa, which supports community-based and culturally acceptable fitness activity, such as dance and walks. So the reason why we were looking at these evidence-based interventions and whether they can be replicated, it's because some of these interventions have been proven. And we know that even in programming, there's that element of short-sightedness that can lead to unintended consequences when they are not contextualized well if they're being implemented in other areas. So we're also looking at that element in terms of even alignment and also in aspect of efficacy. We also looked at how some of renewal of public spaces using similar or even related strategies such as vibrant neighborhoods and communities. And we looked at some programs that have been carried out in some areas within the slum areas that have been proven to be effective and also to be sustainable. For instance, we looked at some programs that even UN Habitat runs that can also be replicated in also the areas like in Uganda and also South Africa and so on. So this was very important because we know that in our communities, there are spaces that can be renewed and they can be used for exercises, because we know that even as there's a lot of changes in lifestyle, and you find that people in affluent areas right now are having more spaces for exercises, morning runs, as compared to individuals living in the slum areas. So we were looking at how we can also use the EBIs that have worked in other countries to be able to renew some of these public spaces. So one of the frameworks that have worked, and it's an example of an evidence-based intervention design, we looked at the REACH framework, whereby it looks at the aspect of fast reach, whereby we looked at even the percentage of people enrolled for the program, whether it's feasible and whether they can be able to access the interventions and the programs that have been designed. We also looked at effectiveness, where we were demonstrating increase in understanding of healthy eating lifestyle, even the percentage of people who have reduced the risks of developing the non-communicable diseases, and also percentage of people attending the programs. So we were using this methodology to measure whether the program, if replicated in other areas, are going to be feasible, but we are also contextualizing them to the cultural dimensions, and also because you know that each and every country and community have unique cultures, and when you're designing the programs, they have to align to the culture of that environment for it to work. We also, another EBI that we employed was the REAIM framework, which we looked at how we can use different elements in terms of looking at who is participating, and we identified some of the institutions like the local government. We also looked at the effectiveness and even the interest, whereby we identified and mapped all the stakeholders in who are supporting programs in those areas, and looked at what they were doing, and also studying based on lessons learned, how they are designed the programs and what they learned from that, and whether based on those programs that they're implementing, whether they can be scaled up or replicated based on the design of those programs. We also looked at the ideas in terms of beliefs, in terms of the active lifestyles and NCDs, because you know that they are context specific. So we wanted also to find out some of the individual beliefs of the community members in the respective areas, and also the cultural values, and also the perceptions of those interventions, and even the current political interests. In conclusion, evidence-based designs normally contribute to sound design. It is very important because they are based on participation, also treatment, and satisfaction. Also, we find that the savings by reducing maintenance cost, improving operational efficiency, and also enhancing user satisfaction is high, because remember that evidence-based designs relies on data-driven decisions. So they're leading to empirical knowledge, and it reduces also the reliance of guesswork and subjective opinions, resulting into more reliable and also effective design solutions. Remember that programs, people invest a lot of resources, both financially and also in terms of other elements. So the probability of a program succeeding or rather achieving the objective it's intending to achieve is very high when you are employing evidence-based design, because they're based on empirical data, and also the decisions are rigorously designed. Then also we looked at even the continuation of the research and also feedback loops in evidence-based design to foster innovation, so that designers and planners constantly seek new ways to improve the programs and also environments based on latest evidence, and also evidence that are context specific. Thank you very much. That is the end of our presentation. Back to you.
Yeah, thank you so much, Pauline. Is Emmanuel around keeping the time or not? Melanie, do you know whether
Yes, I am.
Emmanuel? Okay, so are you keeping the time? Are we in time?
Yes,
So
yes, we are. Yeah.
okay, thank you. So I think we should proceed with the next speaker. We have question at the end of the session. Please, Esham, please, the floor is to you, please.
Thank you very much. Please let me know when you're able to see the screen. Okay. So I'll be talking today about the National Cancer Control Planning, why this should be a priority and why it's important to plan for such a growing public health burden, particularly in Africa, and drawing in my experiences from my time at the World Health Organization, supporting countries doing so. So cancer is a leading burden for disease, leading burden for death and disability across the world, which of course includes Africa. It's estimated in the year 2020 by WHO and IARC in their Global Can that there were 1.1 million deaths, new cases of cancer in Africa, of which there were 700,000 deaths. This is a very high mortality to incidence ratio, which means we need to do a lot better work improving the outcomes for people with cancer in Africa. The problem is we're seeing that there isn't much improvement, or we're not expecting it to happen. With 2040, we're expecting an almost doubling of the incidence of cancer to 2.1 million across the continent and 1.4 million deaths. So there's a lot of work for Africa to do to improve its cancer care at the moment, but also to prepare for the growing cancer burden in the future. As some people mentioned, the transition to non-communicable diseases is neglected in Africa, with the focus mainly on communicable diseases, but that ignoring it does not mean it's going to get smaller. The African continent has a substantial number of countries which are lower income countries and lower middle income countries. And unfortunately, due to the lower infrastructure, we see that the majority of cancer deaths, 70%, occur in these areas. This has been something that's been touched on by many of the presenters here, was the importance of developing evidence and making decisions based on evidence base. The problem we see in a lot of LMICs and LICs is that only 1 in 5 actually have sufficient data to inform policy, and that the rest were either using proxies or assumptions to make policy decisions, which is not sufficient and doesn't work for many contextualized issues. So we need to get better at developing infrastructure to collect data, to monitor it, and to bring people in to voice their perceptions, concerns, and so on around healthcare. On the right, you can see a diagram of the different age standardized incidence rates for a variety of cancers across the continent. So currently, how is cancer approached in the continent and in many places around the world? We kind of take an opportunistic approach, taking small siloed piecemeal, where we put a structure and input and assume that this will have an impact down the line. The reality is it doesn't work that way. The build it and they will come approach is not sufficient. For example, here we're using the purchase of mammography machines or selections of medicines as part of essential medicines. A lot of countries would purchase these and assume that they will have an impact and then are confused on why it does not have an impact. There's a large process that goes in between it. So just purchasing the machines is not sufficient. You need a screening program and awareness campaign that you roll out. And a lot of countries have that, wonderful, more than 80%. But then you need a costed cancer strategy, knowing how much this will cost the country, how much it will be to deploy it, and how you'll deploy it. How will you bring in people to say, okay, you are suspicious or non-suspicious of cancer, and then to ensure the quality of the entire process. The output of that is you're hoping for a high participation rate, over 70%, and only then after you've gotten more than 70% of participants or eligible populations participating, then would you be able to catch early disease and reduce mortality. Similarly, with medicine prioritization, more than 70% are able to meet, decide what are their medicines priorities to purchase, but then others sort of fall through. They're not necessarily approved for HTA, health technology assessment approved, or for their health benefit packages, or that they're not even recognized by their own regulatory authority. We're hoping that once they do this, they then develop guidelines using those medications, that these medications are accessible in pharmacies or hospitals, and that physicians actually prescribe them. Only then do you get an improvement in quality of care, which then reduces mortality. The reality we see on the ground is very few countries actually do the processes in between. We see a huge drop, which means a lot of countries are taking on the cost of the inputs and structures, but not reaping the benefits of sort of the outcomes and the outputs. So it's important here for places like Africa to take a holistic and system level approach, because they cannot afford in low resource settings to take on the cost without the benefit. So this is a large framework for how we approach national cancer control planning, from a results framework, prioritizing the results, the outcomes and outputs we want for cancer, and then working backwards essentially. For time and brevity, I won't go through this in detail, but this sort of gives you an idea. What are the structures and inputs we need to build in place at the systems level? And what do we need to purchase and put in? How is this implemented? So the processes, what are the patient pathways? How are we funding this? How are we ensuring quality and sort of upkeep of the machinery and training of individuals? And what are the results of these processes? What comes out? Are there shorter times? Are we better prepared? So on, and is there better quality? And then the outcomes of those outputs, which are sort of higher percentages of effective coverage, better access to care, availability of medicines, which then finally have the impact we want, which is reduced premature mortality, improved survival, and reduced incidence rates. Sorry. There are foundations to success. We tend to recommend the 3D approach, so data, dialogue, and decision-making. As we said, data is a bit scarce, especially quality data in a lot of parts of the continent, but this is something we need to build infrastructure for. We need to have monitored plans. A lot of countries do not, so they are not actually able to assess what is having an impact and what is not. So we need to work towards that. Governance is also a big issue. We have limited capabilities, and as people were saying about brain drain, this is getting even more strained, but we need dedicated staff with ownership and accountability for different roles, which includes things like cancers. This cannot just be something added on to existing responsibilities. We need to have ways to train, build capacity, not just purchase the technology or design the structures. We need to actually train the people to use them and implement them properly. And we need an implementation strategy. So to move this from an ideation phase to an actual implementation to have impact on the ground rather than just sitting in a bureaucrat's office, we need an operational approach. An example of this is when we reviewed the impact on the purchase of new radiotherapy equipment, whether it was included in the National Cancer Control Plan or not, did not really make a statistical difference. This is not to dismiss national cancer control plans, but it is to emphasize the importance of an implementation strategy is necessary as a part of the National Cancer Control Plan, not an addition or an afterthought to it. Happy to follow up if anybody has any discussions. And this was only a brief introduction. Happy to go in further. Thank you very much, and back to the chairs.
Thank you so much, Sham, for a very short and clear presentation. So we are now going to move to the next non-communicable diseases, which is mental health. Masa, over to you, please.
Okay. Joseph, can you please allow me to share? Thank you.
Yeah, you have permission out.
Can you see my screen, please?
Yes, please, go ahead.
Okay. Thank you very much. So as mentioned, my name is Masa Tarawali from the University of Windsor. Today, I will be speaking on the topic examining mental health service delivery models for Sierra Leonean refugees in Canada, implications for mental health care in Sierra Leone. And this is just a literature review that I am doing towards my PhD dissertation. So it's more around literature review, trying to know what has been researched, what are the gaps out there, and trying to kind of like guide my research area. So by introduction, I am a refugee from Sierra Leone. I was born in Liberia, but raised by Sierra Leonean parents in Sierra Leone. So I have lived through the two wars, Liberian War and the Sierra Leone War. And I have experienced the challenges that accompany the effect of civil wars, and also immigrating to Canada. I have been a refugee, have navigated the system. I've lived through some of these challenges. But through all of these, I have several assumptions within the system. One of the assumptions is that everyone who has been through a traumatic experience as the Civil War has the right to safety, has the right to security. But in terms of safety and security, that could be subjective because we all have different ways of describing what safety and security means. So in the context of my research, or in the context of the literature review that I am doing, I've come to understand the complex influences of civil war on refugee mental health in general, looking at their pre-migration trauma, the transit hardships, and post-migration stressors that are all affecting or shaping their mental health outcomes. One thing I have come to identify within the research that I'm doing, especially in relations to Canada and Sierra Leone, is that there is limited studies on the psychological impact of war trauma on Sierra Leonean refugees, especially in Canada. As I am doing the research, I'm really kind of like even struggling to get data specifically addressing binational experiences between these two countries. The literature is also highlighting the prevalence of mental health disorder among African refugees and issues around like post-traumatic stress, depression, anxiety. There are few studies really kind of focusing on those long-term impact of resettlement. And what do I mean by that? In the journey of an immigrant or refugee like myself from Sierra Leone coming to Canada, there are resettlement supports that we initially receive. Within the 1 year of being in Canada, you receive that support. However, the research is saying that there are still challenges going on in regards to mental health, in regards to access to services, discrimination, and all of those different situations or challenges that continues to impact the mental health and well-being of refugees, including Sierra Leoneans. So what is the impact of Sierra Leonean civil war? The impact of Sierra Leonean civil war, as described by the literature, it was extreme, violence, displacement. There are different issues around loss and grief. But in terms of the mental health spectrum and what has been studied, we are still, or from the literature, what I'm seeing in the gap is that the population, especially the smaller immigrant groups or refugee groups coming from different countries, have not been really explored extensively. So that is why I am thinking, or the direction that my literature review is taking me, is that a binational study might be appropriate in this regard, examine the experiences both in Sierra Leone and Canada to understand the role of war trauma, social support, and mental health care. So like I mentioned, the aim or significance of my research is really looking at, or the literature review I've done right now is really understanding those pre-migrations and post-migration mental health like trajectories, understanding the barriers and facilitators to mental health care, the role of social support and policies and program development, and how all of this plays out in these two areas. So I want to use this diagram to kind of like focus on the things that are emerging in my literature review around the needs of Sierra Leonean refugees. As you can see from this diagram that is emerging from the literature that I'm doing, you can see that Sierra Leoneans who have traveled from Sierra Leone during their departure stage, the things that they have encountered, as described by this diagram, they have endured a lot of issues, unstable economy, healthcare system, and this is still ongoing up till now. The literature is saying that there are a lot of gaps in regards to services and support. And then also moving on to their journey, they also encounter some of these challenges and experiences. And when I talk about the journey of a Sierra Leonean refugee, I want us to look at it from two aspects. Wherein a refugee stayed in Sierra Leone and immigrated through the United Nations and immigration services in Canada, directly to Canada, it's a different experience as compared to someone who departs to different countries like Ghana, Gambia, different countries seeking refuge before their immigration settlement was established when they came to Canada. So upon coming to Canada, there are also other mental health challenges that they encounter that I feel like the literature is highlighting we need to pay attention to. Loss, grief, and that erosion of social network. Sierra Leone is a country that highly focuses on cultural sensitive approaches. There's a collective community, and in addressing our mental health issues in the past, we have focused more on looking at communities and community interventions. So social and psychological needs, but we also see discrimination, racism, isolation. These are all factors that should be considered in looking at the mental health consideration. But another new information that is emerging for me is that reconnection between Canada and Sierra Leone and how that is affecting the individual's mental health. What do I mean by that? I am looking at two countries, looking at a refugee who has stayed in Canada, and the literature is saying that the Sierra Leonean refugee or other refugees are still going through mental health support and mental health challenges, limitation to access, discrimination, and all of these are affecting their mental health. But I'm also looking at a Sierra Leonean refugee who is trying to reconnect to their home country because of the loss, the grief, and that erosion of social network, trying to establish those connections and being caregivers here. Are all these burdens affecting their mental health and settlement experiences? These are some of the questions that are coming up for me in the research, in the literature research. If we look at the landscape, the mental health service landscape in Canada, we could attest that we have range of mental health support, different services and organizations. There's universal healthcare awareness and government support, but we are still seeing issues around financial barriers, wait times, especially for mental health support, stigma, cultural differences, and the underutilization by immigrants and refugees. These are raising questions. If this is a developed country and we are here to seek safety, but with these continuous challenges, what is lacking in the literature? What is lacking in the service provision? What is lacking? One of the gaps is that a lot of the literature are kind of like directing us to the lack of culturally responsive care. And when we talk about culturally responsive care, I also want us to look at it from a subjective view. What I will see as a culturally responsive care from Sierra Leone might be different from someone who's coming from, let's say, another African country. However, we are looking at the integration of cultural factors. So if my research is going to focus on Sierra Leone and Canada, I feel like there are a lot of strengths and benefits to that collaboration. One, it's going to open doors for research in new areas. What happens after the 1 year of the wraparound support that refugees receive? Another issue, another area of limitation that I saw in the literature is when all the immigrant group are being treated as a homogeneous group. With just the diagram that I showed you, it highlights that a refugee's experience is different from other groups of immigrants, because a refugee, as defined by World Health Organization, a refugee is someone who unwillingly, because of forced migration, because of violent experiences, had to leave their homes, so they don't have the choice. So in terms of immigrants, other categories, people have the choice, individuals have the choice in traveling. So making that distinction, I think, in the research is very helpful. And a lot of the articles, we are kind of grouping everybody together. I feel like it's helpful if we want to address the need of refugees, and then especially with my population that I am thinking of studying, I think it will be helpful to make that distinction. Therefore, I would conclude. I think I've spoken about the implication for the mental health care in Sierra Leone. It's going to lead to research in the new areas that are emerging in my literature. I want to highlight the importance of cultural responsive mental health support. The literature is showing us that a lot of Sierra Leoneans rely more on traditional healers, community interventions to address their mental health needs, but Sierra Leone is still struggling also with their mental health system, even right up to today. So a binational study for me, I believe that will inform mental health practices in Sierra Leone, since Canada is a developed world. However, there will be an area of adaptation to influence interventions and make some changes that are culturally appropriate to the support and interventions that are being used in Sierra Leone. And to conclude, I would say that this study will provide like valuable insight into the long-term psychological well-being of Sierra Leonean refugees and the structural factors that shape their access to mental health. I am looking at a binational approach which will allow for a deeper understanding of how war trauma, social support, and healthcare access intersect across these different environments. I am thinking that the findings will have important implications for mental health policy, refugee resettlement programs, and the development of culturally responsive mental health interventions for displaced population worldwide. Thank you.
Thank you very much, Masa. I've been told we have question at the end. I've been told that we have more presentation to this session. As the next presentation is going to be from Sola Awolabi from the Bell University of Technology in Nigeria. So it's going to talk about innovative bibliography game for combating verbal bullying. So, Bello, the floor is yours now, please.
Thank you very much.
If you could stop share.
What do we have to stop sharing for me so that I'll be able to come up?
Masa. Okay.
Okay, thank you. I'll be presenting on bibliotherapy, a game which I have been working on for a while now. It is a game that has to do with our students and then young ones in Nigeria. And then we have been able to expand it to other parts of the world. I'm trying to share my slides. Excuse me. Bibliotherapy has to do with the use of books to heal individuals, to change orientation, and make individuals understand themselves. And this relates to mental health and how individuals are able to manage themselves and integrate into the society properly. So looking at CAACC, which is a game.
We can't see a presentation if you have one on.
Oh, sorry, I thought I've shared it.
No.
Oh, what's happening?
If you can send it to Shazeb, then he can screen it for you.
Okay, thank you very much. I'll quickly share it now. During the years, I
Here, I can present.
It's already in the document.
Yeah, please go ahead, Bello. You can continue speaking while Sharam is trying to share the presentation, and you will catch up with the slide later. Please go ahead.
Sola, you can continue speaking.
Okay, thank you very much. I was thinking I will share that with Sharon, but while we are doing this, we have verbal bullying, which is common among students. And all over the world, we see that in universities, in secondary schools, a lot of students go through verbal bullying. And significantly, it has been related to suicidal thought among students. And Salim, Fatima, and others, 2024, actually worked on this. And from cursory observation also, we discovered that most students have low self-concept, withdrawal from social activities, and poor academic performance pervade our schools because some of the students are verbally bullied in their schools. So we came up with CAACC, which is an abbreviation for positive acronym, CAACC, positive acronym. And the game is developed to turn insulting words or abusive words into positive acronyms. It is rooted in bibliotherapy principles. When we talk of bibliotherapy, that is using books to heal, and then we have another form, which is cinema therapy. We are using videos to also change orientation of people. So this game fosters cognitive reaffirming, and it encourages players to reinterpret negative experiences through the lens of strength and optimism. So they are optimistic when people call them idiot. So you can say, I'm indomitable, I am determined, I am insurmountable, and then I am optimistic, and then I have tenacity. So you can really see that those words may not really mean negative words to them at the end. In the past, when you call somebody goat, that person gets angry, but now people are fighting to become goat, becoming greatest of all time, or guy of several talents, you know? So most people are really interested in turning negative words to positive because they've kept playing this game over a period of time. We have our game on proceedings.com.ng, which about 380 something students have been able to play all over the world. So with this, we have been able to mentally affect our students, and we base this on the bibliotherapy and cognitive restructuring principles. Bibliotherapy is a therapeutic approach that uses literature and language-based intervention to support emotional and psychological healing, according to Gregory and Clark, 2021. Studies have shown that bibliotherapy can be effective in reducing symptoms of depression and anxiety among adolescents, particularly when combined with cognitive behavioral strategies, according to Anderson et al., 2023. So we have used an example of cognitive restructuring process when somebody says, I failed a test. So if you don't have positive cognitive approach, you can say that I'm worthless, I'm stupid. So it leads to depression. But when you have been cognitively restructured, you can say, I failed a test. So your internal belief is that I'm smart, but I didn't study well for this test. I can do better later. So depression goes out of you. That is the example of cognitive restructuring. So when you are called stupid, you can say, I'm smart, talented, unperturbed, positive, insurmountable, and then determined. So you can see that stupid means something positive to you. And this game suggests several negative words, and then it gives you several positive words to replace or to interpret this as acronyms. So every word that is said, when somebody says you are mad, you say, I'm making a difference. Making a difference. So it is not seen as the word mad, it is seen as acronym. And in the game, we have a lot of words that start with M, a lot of words that start with A, and a lot of words that start with D. So you can choose from them to be able to actually have something positive. So we have benefits of POSAC, which involves positive thinking, emotional and social resilience, mental health, empowerment through play, social skills, and then it also ultimately increases vocabulary of students. So with this, we have been able to come up with POSAC, and we have been seeing positive response from students, though we have not actually carried out a bibliotherapy investigation on these people, but few comments that we have got, this have been encouraging, and then we are looking at ultimately, when we have 1,000 players, we'll be able to actually carry out a good research work on that and be able to see how far it has really encouraged them. So conclusively, we say verbal bullying could negatively affect young people and adults. And because of this, we have explored multidisciplinary approach. I have people from computer science, I have people from library and information science, people from communication. We came together, and language, we came together to actually come up with this, me being the lead author. So we've been able to tackle verbal bullying by developing POSAC, a therapy game that is deploying technology to play. And also we have the physical aspect of it now, where we have cut cards into pieces with these several acronyms. We don't call them words. And then we've been able to put them together and then letters to form words by students to actually create positive impression in their mind. We therefore recommend that members of the global community should interact with the game and encourage friends and family to take advantage of the same. And I'm sure that with time, we'll collaborate with people from different parts of the world, especially some people from other parts of Africa and also the Western world will be able to do better investigation and then improve on the game, and we'll be able to affect lives of younger ones among us. On this note, I say thank you for the opportunity to make this presentation. I'll send the slide later. I've been involved in training, and I just have to stay back after I finish training with these people. So I don't know what happened to my computer. I apologize. I will send later. Thank you very much.
Okay, thank you. Thank you very much. We had 4 interesting last presentation. We are going to have 2 or 3 questions for the presenters, but I think I'm going to have the first one for Hesham. Hesham, from your experience in WHO, because of you talk about the challenge with getting data on chronic disease in Africa, which is very, very big challenges. And most of the country there have a problem, in fact, getting census, data from census for the existing infectious disease. I'm wondering if, from your experience in WHO, what's the view? What is the response? Is that the responsibility of the countries or the donors or what?
I would put it very strong. This is a problem, and thank you very much for pointing that out. I would very strongly say this is a country problem. In saying that it's a donor problem, you put the accountability on the donor to actually deliver, but you have no way of holding them accountable. If an entity is donating money for you to do something, if they don't do it in the right way, there are usually very limited legal repercussions or ways to hold them accountable for doing it, and would limit your ownership of it. It also promotes sort of siloing of care. We see that in a lot of aid organizations where they're focused on one particular kind of disease rather than looking at the population as a whole. So the only entity, if this is a public provided service, which most countries in Africa are at least aiming to achieve, you need to have this centered in the public system, having registries for healthcare and maintaining good census data. It is a challenge to build that up initially. That is, of course, something I'm willing to admit, but there are ways to support that. And even if you're not able to scale it up to 100% initially, you can start making informed decisions based on silos and then expanding it to the larger country. I hope that's helpful.
Yeah, thank you. Thank you so much. Any other question for 4 of our speakers? So it's appear that we don't have any further question. In fact, because of the time, perhaps Melanie, offers to you for the rest of the conference.
Thank you very much, Dr. Kandala. You chaired a very interesting session, a lot to digest. And thank you. So now we are moving towards closing the conference, and this session, the closing keynote, will be chaired by Pauline Omolo. Pauline?
Greetings once more. We have listened to different presentations from different countries. Now we are almost done, and I would like to take this opportunity to introduce our last keynote speaker, Dr. Hesham Gafar. And Dr. Hesham is a physician licensed in both Egypt and the UK. And after starting his career in clinical oncology, he transitioned to focus on public health systems with an emphasis on maximizing value and fostering innovation in low resource settings. So he furthered his training by completing a Master of Public Health as a Fulbright Scholar at the Harvard T.H. Chan School of Public Health and a Master's in Precision Health at the University of Chicago. Dr. Gafar has extensive knowledge in supporting innovation, value generation, and priority setting in healthcare globally. He has also advised multiple team setups and consulted on health system reform at both national and local levels. During his tenure at the World Health Organization headquarters, he supported governments across 4 continents, helping to set priorities, developing strategies, and plan for cancer management in their countries. As a Kifat Research Fellow and awardee, he assisted the Nigerian Health Research Committee in developing frameworks to facilitate locally impactful health research. Currently, Dr. Gafar is a consultant supporting the World Health Organization in Palestine in the development of a cancer strategy. We are going to be listening of his keynote speech on uncertainty to opportunity. After that, he's going also to highlight the discussed topics and emphasis as requested. Over to you, Dr. Gafar.
Thank you very much, Pauline. I appreciate that kind introduction. And to all of you, you get a double feature of me. Hopefully that's not too much of me and I don't get to bore you. I want to start off first acknowledging all the incredible people who have made this conference happen, the chairs, the rapporteurs, the facilitators. Thank you very much. I also want to take this opportunity to thank all of you who are still with us after a full day of insight and learning. I particularly like to recognize those of you joining us from across Africa, staying with us late into the evening. This is a testament to your deep commitment and belief in the potential of the Canadian-African collaboration, as fostered by Western University's very own Africa Institute. As we gather here, the world around us is changing at an unprecedented pace. This acceleration is felt in almost every possible sector and industry, transforming many aspects of our daily lives. It seems no part of modern life remains untouched by critical changes or challenges to its core assumptions, practices, and expectations. These shifts are fueled by several factors. These include the innovation occurring in artificial intelligence, creating a new industrial revolution, the dramatic changes in financing sources and their availability, as we've seen with USAID and now in the UK as well, emerging challenges to the law-based order, and of course, the ever-urgent climate crisis, which we've touched on in several aspects today. Everything is becoming tuna, turbulent, uncertain, novel, and ambiguous. In the face of these evolving circumstances, the only way for us to truly navigate and thrive is by creating new knowledge through research, which a lot of us are doing as academics. We must also address these unique challenges head on. Furthermore, collaboration across institutions, across countries, and across continents allows us to learn from one another, share insights, and reduce risks we face if we attempt to, which would be much higher if we attempt to navigate this complex world independently. The systemic exchanges that we are experiencing and that we will continue to experience should be viewed as an unprecedented opportunity, not just as a challenge. This is a chance to improve and refine many of the established structures and relationships in academia and beyond. It is no secret that many of the structures that exist at the moment are unfavorable to numerous individuals, communities, and societies, particularly those in the global south. This is especially true in Africa, where the emphasis has predominantly been on extraction rather than creating real growth and advancement in a collaborative approach. In this context, the work of institutions such as the Africa Institute are becoming much more important. The presence of platforms such as this inaugural conference serves as a beacon of hope and opportunity in today's climate of uncertainty. The role of such platforms is essential. Through these collaborations fostered within this institute, we can establish the frameworks necessary to uncover knowledge that breaks the silos between academic and economic sectors and helps growth both in Canada and in Africa. These efforts will enable Africans and Africa to realize their potential and thrive in today's global landscape. We must work together to build strong, lasting connections centered on growth with mutual respect at the center and of Canada and the diverse nations of Africa. We have a unique opportunity before us as we join forces to shape a new narrative for collaboration that is equitable and impactful. I want to begin by re-emphasizing something that resonated with a lot of people that Abe mentioned in his opening speech, was talking about the academic versus activist dynamic. This seems to have been a theme that carried on through multiple of the presentations and which a lot of people commented on in the discussion section. This here is a discussion about how academia can be disconnected and the importance of us going into the field, making sure we have an impact that resonates with people, because we seem to have lost a lot of that direction in academia. The purpose of research is eventually to have impact, not necessarily the number of publications. And in this global world that's shifting, our expectations are changing, we have a very high risk of retreating back into our ivory tower and looking inward. And Canada and Africa should do more to reach out. And this is where the inaugural conference and the Africa Institute come in. The approach to having compassion and passion both shined in very much so in a lot of the discussions people were having with their, I think the best way to describe the coming together of passion and compassion is talking about human-centered design. It seems a lot of the presentations and collaborations people were talking about had humans at the center of them. They had passion for the outcomes they were achieving, but they had strong compassion for the people they were working with and the people who were implementing their strategies or research or utilizing it. And here we need to emphasize that knowledge isn't shifting from being unidirectional, flowing from the Western world to Africa, to more of a cross-pollination approach, where information moves from Africa to Canada and then back and gets adapted in each way in a big field of flowers. We had the first session talked about education, speaking a lot about the extensive experience in blended and bidirectional learning with a global classroom, talking about their experience and their key findings, which would be effective education, being valuable to many sectors on how to inform different people and how to create an engaging environment. The Khan universities, virtual and on-site formats, looked at how to build hard and soft skills. And the thing that stood out very much for me was in their video that they shared, where there was an African mentor with their Canadian student and was talking about how the Canadian student at the end of the experience came out as an independent researcher. And this showed the shift from mentorship to independence. And there was strong value for me in hearing this being described as independence, especially coming out of Africa. The emphasis by AKU, as well as the University of Nairobi, was on learning from Africa, not just in Africa. And this should, again, as we said, break the stereotype that Africa just takes knowledge. No, Africa is a knowledge generator. And then we get the discussion around the Canadian-trained Somalis and how they are acting as a reservoir of resiliency and rebuilding for Somalia after being in Canada. And this brought to mind Canada's long history of being peace builders and developers, which was a strong part of the Canadian identity. And maybe that has been lost a bit more recently, and how this could be an opportunity to revitalize and reemphasize this. When talking about policy, we saw the Nurses Association of Ontario, how they are looking to expand into Africa, starting off with Nigeria. This is showing their recognition of both the need and the opportunity, and how they're also shifting from just research to implementation, leaving the ivory tower as we were discussing, and that they're seeing the results of these partnerships in the form of empowered nurses. The integrated approach to monitoring and education, we're looking to see that they're recognizing the environmental impacts on the continent, which tended to be ignored or deprioritized unless they were explicitly stated. We are moving to have this integrated into the system to act as a development hole to make sure that the environment is always considered when we are looking at policy evaluations. Climate is a huge issue for Africa, which we heard about in the thematic approach. And we heard the opening part included how machine learning will be applied to air quality monitoring, showing that as the AI revolution is happening, Africa will not be lost and not forgotten behind, and how it can reap benefits for Africa. We heard about the holistic and planetary approach to health, learning about how climate's impacting food security and poverty, how that impacts then diet and access to food, and then short-term memory, which has impacts both not just for health, but also economic impact. Again, breaking the silos. An important word that was used was choosing to use the word investment rather than aid, and here discovering opportunities for efficiency gains and reducing food waste, rather than just saying we need more food or we need more money for food. So it is important to this reframing. The emphasis on smallholder farms shows that this is, again, a movement towards resiliency, as we find that more smallholder farms are resilient than large monoculture farms, and that they are the most vulnerable. But they also highlighted the older generations were more open to climate smart activities. And this could be an opportunity for Ghana to act as a knowledge hub for Africa and the world, and use its elders to provide information as mentors to other people around the world. We also saw the gender imbalance with the preference of female farmers for cultivation of food for sustenance rather than cash crops. And this could again be important how we approach access based on gender, how this could improve resiliency and build capacity. We heard about indigeneity and the experiences of indigeneity and how they might be a bit different in Africa versus in Canada, but there are also similarity in experiences with opportunities for cross learning and building, fostering Indigenous relationships, stewardship in both Canada and Africa, using similar approaches, particularly around land ownership, an important topic on both sides of the Atlantic. There was also a discussion about formalizing Indigenous games and elevating them in the perception, such as games such as rugby, and recognizing and emphasizing local African identity and potentially exporting those to the world as an economic driver, as well as a social, cultural dynamics that come into challenge when formalizing this. We heard from the future African leaders in the Canada Africa Young Scholars Coalition and how they are supported by different bursaries and networks, and how the diaspora in places like the Dominican Republic and Haiti are part of the continent's resources and can act as knowledge sharing places. But we also learned about sort of how the challenge of tokenism can act as a hindrance and how we move that towards impact and develop policies that are impactful and not just tokenistic, and the importance of experiential learning, that it has an incredibly strong impact for learning for students and how that should be emphasized and opportunities to do more of that, and how we also receive recommendations from the students on how to navigate cross-border and cross-cultural interactions. In the infectious disease, we saw a real-life example of knowledge coming from Africa being exported to Canada with the HIV prevention program, with the peer navigators having an official role in health services to improve sustainability. And that's something we can look to in Africa a bit more, to especially with the challenge of brain drain. And with Africa's multi-identity, the question of who accounts for a peer becomes more important as we implement different programs and structures. Finally, with NCDs, we got to discuss a bit more about the globalization, how that brings challenges in terms of urbanization, diets and lifestyle, and how we could reform that, learning about the vulnerable in Africa, especially in slums, to provide insight on nutrition to access, how studying and working with individuals in Africa can provide insight on the nutrition and access among the most vulnerable in Canada, particularly the migrant groups, and the importance of cultural alignment in both areas, and how the experiences of Africans, particularly refugees in Canada, might inform the building up of healthcare, mental health care in Africa, as well as the understanding that not all of Africa is monolith, as experienced the Sierra Leoneans on their own. Their transition to Canada is multifactorial and different. In conclusion, I urge all of you to recognize the significance of our gathering today. Let us not just only share the knowledge and insights, but also commit to working collectively. Together, we can ensure our actions make a meaningful difference. So let us harness the power of this collaboration to navigate this turbulent, uncertain, novel, and ambiguous world to create impact for Africa, Africans, and Canada. Thank you very much, and I hand over back to Pauline.
Thank you very much. Thank you for that succinct summary of takeaways. And I'm very sure for the ones who joined late, they've been able to follow and actually know what happened in the conference today. Before we close the session for the key takeaways and the last keynote, any comment or any question from anyone? Let me just check if there's any question. Yeah, if there's no question, thank you very much, Dr. Gafar. And let me hand over to Melanie.
I have a comment, actually,
Yes.
not a question.
Okay.
And the comment is, we do have an Africa Institute at Western community, and that community includes us in Canada as well as partners in Africa. And we meet every month to seek collaborators, just to discuss what we are doing between ourselves in Canada and Africa. And if you'd like to join that community, please send an email and I will put it in chat, and we will include you on the mailing list and with all the, the communication that we put out to reach you. So it's african@uwo.ca. And please reach out to each other. If someone identified someone that they think they can collaborate with from this conference, please do so. And I would also like to let you know that we did record the entire conference, and we will be making it available on the Africa Institute at Western's website, and also extracts of it on social media. I see Dr. Saverio has been able to rejoin us. Do you want to say the very last word?
Sure. First of all, thank you everyone for attending the conference, especially those who have been online all day long. As I said, it would have been nice to have this conference in person, but this was the most efficient way to engage also our partners from across the continent. I also like to thank all the chairs and the co-chairs, the speakers, and also my colleague and friend, Dr. Melanie Catzivo, for her leadership and making this happen. So Melanie, thanks again for all your efforts and passion in leading the Institute. And yes, I'm sure that this will facilitate networks and further growth of the African Institute community, as we have very committed to expand our networks, not just within our university, but also globally. That's it from my side, Melanie.
Yeah.
So oh, go ahead, Shazam.
I was just saying, it'd be great if everyone could just turn their cameras on. We're trying to get a picture for the website. We'll see all our beautiful faces on it. So if everyone could just turn their cameras on real quick, that'd be awesome.
Beautiful face, except for me, but I agree with your comment.
Are you going to get the panorama? I don't know what they call it. I guess it's panorama view, where everyone is on the screen. How do we do that?
I can only get a certain amount of people on the screen, but I think there will be plenty.
What's that called? Panorama?
Something like
There's a term for it.
Okay. So I will take this picture now. Hold on. Okay, got it. All righty. Awesome. Now, before everyone heads out, when we finish up, we also have a feedback form. The feedback form is where you can share your thoughts on how the conference went and everything like that. I'm about to post a link in the chat, so we'll also try to email it to everyone. But here's the link now. If everyone could just fill that out real quick, that'd be awesome. Thank you, guys.
Thank you so much, everyone. And thank you for being with us all day to the very end. Watch out for more communications and visit our website for other information. Thank you, and good night or good morning, wherever you are. We will now end this conference.
Thank you.
Thank you. Bye.
Thank you, everyone.
Bye.
It's been amazing.
Thank you so much.